Oh, all right. All right. It looks like I got it set up. Whoops. Whoop, whoop, whoops. There we go. Hello, my friends. It's Jill Osborne from the Interstitial Cystitis Network. It is Sunday, October 16th, and it is time for an IC support group meeting. And we are now streaming on 3 platforms at exactly the same time. Hello, Alicia, JS, and Curly on Instagram. I see you. Hello, you guys on Facebook. I see you guys. And hello, you guys on YouTube. I see you. I don't know. I just decided to try to be bold today. You know, what's my favorite affirmation is be bold and mighty forces shall come to thy aid. I figure I built the first website on IC. I did the first live support group meetings on IC on the internet ever. I'm going to be the first to stream on 3 platforms. Hi, Lisa from Texas. Hello, Jennifer. Hello, Jessica. How are you today? How is life? So this is a big week for us. This is a very big week for the IC world because we are having our first National Institutes of Health IC meeting in a decade. In a decade. I have to get up at 5 a.m. tomorrow. So I am participating, and it's going to be very interesting to see. I can tell you right now from looking at the agenda, it's all about subtypes. You know, I got to tell you something that's just so incredibly important. And that is patients have to have a voice. That no matter how much researchers study IC and try to understand IC, they don't live with IC. They do not understand the day-to-day reality about what our life challenges are, what our pain feels like, when is our pain the worst, when is our pain, you know what I mean. And so back when I started the IC network, I had this lofty goal of that I would, a third of it would be for patients, a third of it would be for researchers, and a third of it would be for doctors. And I really worked really, really hard to validate the importance of your voice. Because we can do great things when we work together. And the most important thing we can do is we can work with researchers. You can participate in clinical trials. You can share your story in research studies. And so what's been so kind of entertaining for me over the years is I have used certain phrases that slowly but surely you see spread throughout the IC world, around the IC world. And so our book, IC 101, it's not just a bladder disease. What did we, come on, that was 3 years ago. Our new guidelines very clearly say IC is not a bladder disease, it is a pelvic pain syndrome. So we have been right pretty much every time. We were right about using supplements. The AUA guidelines encourage the use of supplements. Oh gosh, we're getting a lot of waves here on Instagram. You guys, this is my first time streaming live on Instagram. You guys bear with me. I can't say I know what I'm doing on Instagram. So anyway, it's been very frustrating over the years to watch doctors come up with their own biases and beliefs about IC without ever talking to us. And you can tell when, for example, a clinical trial is being released and it hasn't been vetted by somebody experienced with IC. That's what I offer now to clinical trials, is I do that for them. I still remember one IC Awareness Month campaign before I took over IC Awareness Month. Like they were saying diet was okay and you could drink coffee. It's like, come on, guys, really? So anyway, just to let you know that what have we been saying all this time? That we have a lot of differences in the IC patient population. For some of you, IC begins in childhood. Hi, Mary. For some of you, IC begins after menopause. Are you the same? No, you're not the same. For some of you, IC begins after having a baby, while for others, IC begins after going through chemotherapy. Are you the same? No, you are not the same. Why have $100 million of IC research studies failed? That's what Dr. Phil Hanno said to an AUA meeting about 10 years ago. We have invested $100 million in trying to find new treatments for IC. Why have they failed? Because you can't expect an apple, orange, and banana to behave the same. You cannot put all of you in the same research study. We are very clear different. We have very, very clear differences. Bladder therapy has never worked for me. Why? Because I'm not bladder driven. I'm pelvic floor driven. What worked for me was pelvic floor physical therapy. Then I have to keep on it. So I'm very, very thrilled to see that virtually this entire conference is dedicated to understanding the subtypes of IC. And how are we going to apply that to research studies? And how are we going to apply that to treatments? And how are we going to have customized treatment plans for each variant of IC, right? So this is huge, and I'm so excited. I just have to get up really, 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 really early. I can remember at one of the very first NIH meetings I went to in Washington, D.C., back before COVID, I was stunned to see all the top IC researchers in the world at the meeting. There were about 200 people there. But they never talked about you. They never talked about patients. They never did. They talked about science. They talked about how the bladder works. And I was just sitting there going, can we just spend 30 minutes talking about how to treat a Hunner's lesion? And I went up to, I interviewed the head of the National Institutes of Health back then, actually appeared on our IC and guest lecture series. And so I went up to the NIH staff and said, can we please spend 30 minutes talking about how to care for patients? And they were like, no, we're interested in the research, but the research doesn't get you better necessarily. We always have to focus on what can we do to give you skills and tools that will help you get through the day when you're having a flare. And speaking, Lady Liberty on Instagram says they're done making money off of me. Let's see. Lady Liberty says, I cured the pudendal neuralgia and pelvic floor with psilocybin therapy. It's completely gone. Okay. I can go there. So Lady Liberty, actually, one of the reasons why that might have helped is because of the research that has been done at USC now, where they're actually using transcranial nerve stimulation to change the way certain portions of the brain behave. That's the research of Dr. Jason Cush. And that's where we focus kind of on IC subtype 5, central sensitization, where we do see changes in the way the brain is behaving. And they're now using neuromodulation to try to improve that for the better. There was a very important study done through the MAP Research Network and USC of men with chronic pelvic pain. And what they found was they were unable to fully relax their pelvic floor. They just couldn't do it. And the question is why? And they were kind of, and obviously for us, we're going to look at muscles. Do you have tight muscles? Of course, if you have tight muscles, you're going to have trouble relaxing your pelvic floor. But they're also studying the nervous system and trying to figure out if the nervous system is playing a role in that. So maybe potentially what they're saying for you is that maybe that's why that helped for you. But we have to do a lot more research on that because that's not necessarily going to be a therapy offered in a lot of different places, right? Hello, K-Trey. Hello, Jane. Hi, Linda. Okay, so again, we're on 3 platforms here. So if I'm looking straight, I'm looking at Facebook. If I'm looking over here, I'm looking at YouTube. If I'm looking down here, I'm looking at Instagram. So let me go back here and let me get a drink here. If you want to know what I'm drinking, I am drinking a Dandy Blend herbal coffee frappuccino. I was working with a patient the other day who severe symptoms, loved drinking her coffee every day. She had Hunner's lesions, And I explained to her, I asked her, I said, if you had an open wound on your hand, would you pour coffee on it every day? And the answer, of course, is no. And I said, why are you doing that to your bladder? What would happen to a wound if you poured coffee on it every single day? And the light bulb kind of turned on for her. The thing you have to remember is that the bladder is the slowest healing organ in the body. I got this from another National Institutes of Health IC meeting. So imagine an extra large pizza and imagine a little tiny green pea. So that extra large pizza is the equivalent of the umbrella cell in your bladder, okay? That's the top superficial cell. The largest single cells in the human body are the umbrella cells of the bladder wall. But they can be damaged. They can be damaged usually through some sort of chemical exposure. So what happens when one of those cells is damaged is that there's a little tiny stem cell, that little tiny green pea. And it takes 2 weeks for that green pea to change size and shape and fill in where that umbrella cell used to be. Unfortunately, as they explained, Dr. Anthony Schaefer in a lecture he did on how the bladder heals, that cell as it's growing is exquisitely vulnerable to acid. Thus, 1 cup of coffee will kill that entire generation of stem cells trying to repair your bladder. And I remember at the meeting, I was looking at all the other international people that were there with me, the other patient representatives, and we were looking at each other going, yeah, because the patients who suffer the most by far are the patients who drink 1 cup of coffee a day. You don't understand that you're setting yourself back 2 weeks worth of healing for every cup of coffee you drink. Your bladder simply will never be able to repair itself. That is the physical reality of how the bladder repairs itself. So if you have a bladder wall injury or you have Hunner's lesions, your job is to create an environment that will help that tissue heal. And what will help that tissue heal is chamomile herbal tea. Chamomile herbal tea is very calming. It calms nerves down. It's soothing. It's gentle. Far, far better than regular coffee. But a close second, Dandy Blend herbal coffee. You can get it in the IC Network shop. Love it, love it, love it. You can get it on Amazon. That's what many, if not most, coffee drinkers switch to now. All right, let me go here. And you guys, my neck. I didn't do my meeting last week because I hurt my neck. And it's still quite tender. It's very tight. So we'll see how long I last. I got rear-ended really badly in my 20s when I was commuting to San Francisco. And I got wicked whiplash. And every now and then it just comes back. All right. Ruth, just diagnosed with a UTI again. Pissed. Hope you're doing well. Ruth, I'm so sorry. So Ruth, just obviously UTIs can happen. We do not believe that UTIs are the cause of IC anymore, although one really, really bad infection early on could have been a foundational trigger for that. But for the great majority of us, we really are not having active UTIs, but UTIs are possible. I've had 1 UTI in the last 30 years, and it was a wicked UTI, I gotta say. Hello, Susie from Canada. Thank you, Jessica. Cassandra said, I just got diagnosed with IC and no doctor is helping me. So Cassandra, you're not alone, girl. Listen, you're not alone. You got to understand that IC is a grab bag diagnosis. It basically means that you have frequency, urgency, pressure, pain, but they don't know why. And it's not a very good, let's just say it's like driving into a brick wall. It's like, okay, I have a diagnosis, but oh my God, what the hell is IC? And then you come onto Facebook and you go to some Facebook support groups and you get the living daylight scared out of you. So I'm writing a whole new section of the IC Network website for brand new patients, newly diagnosed patients. So you can help me work through this in my brain. So number 1, you're not alone. You are absolutely not alone. You have many brothers and sisters, millions of brothers and sisters who struggle with this too. Number 2, it is not an incurable bladder disease. That's what they said 10 years ago up to the last 100 years ago. We don't think of it as a bladder disease anymore. We think of it as a pelvic pain syndrome. Why? Because structures outside of the bladder are often involved. Okay. So the question then is, you now have to be a detective. And the more you learn now, the better you're going to be working with your doctors and being able to ask them the right questions. The worst thing you can do when you go to a doctor is tell them, like if you're getting a second opinion, is to say, hey, I've got IC, can you help me? It's like, no, don't ever do that. Don't ever do that. You walk into the doctor's office prepared to discuss your symptoms. And it's the weird symptoms. It's not just the, okay, I can't sleep at night because I'm getting up to pee all the time. It's the, oh yeah, when I have sex it's painful, or when I sit down I have a vibration, or my feet hurt. Your ability to describe your symptoms provides a roadmap for the doctor to try to figure out what the heck is going on. And that's what we've got to do for you now, is we got to try to help you understand. So the second thing is understand that there are distinct groups. We have patients who have bladder-centric problems, like Hunner's lesions, which are big bloody wounds on the bladder. That's a small percentage of patients. And we now know what causes that. We know that that could be a viral infection. Mary, no, I haven't. Number two, we have many patients, women, who develop bladder symptoms because of estrogen atrophy. If you've just started birth control, if you're on Lupron, if you have had a hysterectomy, a total hysterectomy, or if you're just in your 40s or 50s, you have to understand that your bladder needs estrogen to protect itself. Your bladder is like your mouth. It's a hollow organ covered with a really thick coating of mucus, and that mucus protects your tissue. Unfortunately, that mucus is estrogen dependent. So when you're young and you've gone through puberty, you have a lot of estrogen, you have a lot of mucus, and your bladder can defend itself. When you're older, or you're on birth control, or you've had hysterectomy, you don't have the estrogen. Thus, your bladder's ability to defend itself is now compromised. That's not a disease. That is estrogen atrophy. We're also going to look for chemical injury of the bladder, okay? Because the bladder, like any other part of the body, can be hurt. And usually it's hurt through some sort of chemical exposure. So if you're drinking a lot of soda, you're drinking a lot of green tea, black coffee, whatever, that has the potential of irritating your bladder. Or if you've gone through chemotherapy, if you've been on certain medications, you've used ketamine, that's going to irritate your bladder. Okay, so bladder-centric is one clear group. Our next group is pelvic floor-driven. So these are the patients whose symptoms began after some sort of trauma, falling on their tailbone, having a baby, being an ice skater, being a gymnast, being a football player. If you've fallen downstairs, anything at all like that, we're going to look at the health of your pelvic floor. And so again, I was working with a patient last week whose symptoms were very complex. And she had pain kind of all the time before urination and after urination. And we're just, whenever I do coaching, I don't want to hear about your treatments yet. I need to understand your body a little bit more. And it's like trying to, find a needle in a haystack talking with you sometimes. And finally, 20 minutes into our conversation, she goes, oh yeah, I had a really bad childhood injury where she had fallen on a bar between her legs and was bleeding profusely. And that was her pelvic trauma. And sadly, abuse can cause pelvic trauma too. But anyway, after trauma, what happens is your muscles get injured, they get tight, they start to restrict blood flow to the bladder, they start to damage nerves, and that's going to cause symptoms. Of course, you have no idea you have a muscle injury. Your first symptoms are frequency, urgency. You think you have a UTI, you do the antibiotics, they don't work. Here's Leah on Instagram. She had chemo. Yeah, there you go. You go back to the doctor, you still have these symptoms. The doctor goes, let's do long-term antibiotics. They don't work. You go back to the doctor again. The doctor goes, hey, I think you have overactive bladder. You do those meds. They don't work. You go back to the doctor with another flare, and the doctor goes, hey, I hate to break it to you. I think you have this, quote, incurable bladder disease. called interstitial cystitis. Here's some Elmeron. Here's the diet. I'll see you in 6 months. And you want to get better, you go home and you do it for 3 months, 6 months, a year, 2 years, 5 years, 10 years, 20 years. And you're still flaring and you're still getting up at night. Why? Because bladder therapies don't fix muscle problems. Physical therapy fixes muscle problems. And pelvic floor physical therapy is far more effective than any other treatment in research studies for the treatment of IC. And when that research came out in 2008, the IC world turned on its head, because up to that point, everybody's going bladder, 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 bladder. Oh, but wait, physical therapy helped? Maybe it's a muscle problem. Okay, so that's a group. Another group of patients are patients with pudendal neuralgia, which can be a nerve injury. So if your symptoms are positional, if you're fine when you stand up, but when you bend over, it hurts, or you sit down, it hurts, and you feel better when you stand up, okay, then that tells us that your symptoms are being driven through musculoskeletal forces, because you're moving and it's getting back, it's getting better and worse. And so therapeutically, we're going to try to work on finding the nerve that's compromised and trying to figure out why it's compromised and get rid of that compromise, which is usually tight muscles. And last but not least, our last subtype is central sensitization. These are the patients who have IC, vulvodynia, IBS, TMJ, fibromyalgia, migraines. And we now know what that is too. That is actually an injury to the central nervous system, or what happens after the central nervous system if you've been injured with central nervous system. And you guys on Instagram, my phone is kind of crooked and it's kind of low, so I apologize, but I'm expecting my phone to fall out of the holder. So if it does, well, good luck. Okay. So as the AUA guidelines say, if you're not responding to therapy, if you're getting worse rather than better, take a step back, revisit the diagnosis, and ask yourself, what have we missed? For example, I worked with another patient this week. Again, it's just so important that we ask these questions. She felt fine in the morning, absolutely fine. But as the day went on, her symptoms got worse and worse and worse and worse. And she felt by the end of the day like she was carrying a bowling ball around in her pelvis. And she could barely walk. Okay, that's not your bladder. That's pelvic congestion syndrome. And actually, she had been in the ER. They had done a test. They saw the pelvic congestion syndrome, and she was shocked that I brought it up. I mean, it's not my bladder? No, it's probably your pelvic congestion syndrome. We sent her off to an interventional radiologist. All right. Okay, so here, hold on. Presidum on YouTube says, my gyne wants to switch over to a bladder instill to reduce Elmeron for me. Elmeron is working on bladder wall estrogen atrophy pelvic floor. Okay, so listen. This is what you have to understand about Elmeron, aside from the fact that it is linked to very severe eye disease, blindness, right, for some people. Medications have what we call a bioavailability, and that is how much the medication arrives at the site of the problem to be effective. Because when you swallow a pill, your body is going to attempt to digest it. So the question is how much the Elmeron survives to arrive at your bladder to do something beneficial. And here's the thing, a lot of you don't understand about Elmeron. It has a terrible bioavailability. The company itself, which at the time was Baker Norton that had it, they did their own bioavailability studies. They published it. Only in their study, 8% of Elmeron arrived in the bladder to provide any sort of meaningful therapeutic effect. The rest of it was destroyed by digestion. So that's the problem with taking an oral medication, is a lot of it gets destroyed. In the case of Elmeron, I've talked with doctors more recently who believe it's 3% or 5%. So the more effective way of using Elmeron is to put it directly in the bladder in the form of a bladder instill. So Prasid, listen, 100% of the medication arrives in the bladder to be therapeutically effective, and it doesn't carry the same risk of eye issues, at least that we know of. So the bladder instill for what you're dealing with, which is estrogen atrophy, would be far more effective at putting a coating on the bladder wall than you swallowing it. So I support your gynecologist wanting to switch you over to bladder installations. It is a much more effective way to use the medication. It is. Now, this is something that thousands of IC patients have had to face over the last 3 years. Is Elmeron really worked for you? But now some of you have very bad changes in your eyesight. Some of you are participating in the lawsuits now against the company. What do you do? Some of you have been so terrified of the symptoms that you don't care about your eyesight. You just want to do the Elmeron. And I want to try to give you context here. Elmeron provides a coating effect. It's a Band-Aid. And in fact, this is one of the original Elmeron. I'll show it to you right there. Elmeron, right? So this is one of the older original patient education tools. And so that blue layer is the coating of your bladder. But you can see if it's damaged, urine, now gets down to these umbrella cells that are so important to your bladder health. And so they show Elmeron as providing a coating right here. Okay. However, Elmeron is not the only bladder installation. Heparin also provides a coating. In fact, the most popular bladder installation out there is a rescue installation made of heparin and lidocaine or marcaine or bupivacaine, something like that. And so we've got the coating effect from the heparin combined with the nerve numbing effect of the anesthetic. In Europe, chondroitin is a bladder treatment, IC treatment, liquid chondroitin put directly into the bladder. The bladder is composed, has chondroitin molecules in it. Chondroitin plays an important role in the superficial integrity of the bladder wall. Sodium hyaluronate or hyaluronic acid is also a coating that has been used. The bladder wall also has sodium hyaluronate in it. And the two medications have been combined and when they're combined, they're the best of all, chondroitin and hyaluronate as a bladder coating. That is called Ialuril, Ialuril. Unfortunately, it's not available in the United States. So we don't usually put, here, hold on a sec. We don't usually put chondroitin in the bladder wall here. They didn't go through the necessary FDA approvals to do that. So what do we have instead? We have got chondroitin supplements like Sister Protect, Bladder Builder, Bladder Rest, et cetera, but they have the same bioavailability issues that Elmeron does. It's just what we have. So for those of you who have a compromised bladder wall and you're looking for a coating effect and you're in the United States, you have two options. You can go for the bladder instills, rescue instills, or you can go for the chondroitin supplements. Those are your only options. We have nothing else. Oh, I will do that. Hold on. I hate it when that happens. My foot hit my chair setting. Kathy says, my doctor diagnosed me, though it was unheard of at the time. IC attacks tissue. That's simple. It's an autoimmune disorder. I got an Interstim and Myrbetriq infusions of painkillers. Not sure I could have made it through. Kathy, unfortunately, it doesn't meet the criteria as an immune disorder in the great majority of patients. Now, is there a small subset of patients who have autoimmune issues? Yes. Hunner's lesions. When you have Hunner's lesions, that implies that there could be an immune system going on. We know that there's a massive amount of inflammation in Hunner's lesions. And we do know that there are some patients who have lupus and Sjogren's who also have bladder issues. Also, Lyme disease can also have bladder issues. The research has shown that's really, if I remember correctly, only 2 to 3% of the IC patient population. So none of the top researchers around the world consider IC an autoimmune disorder, although everybody admits that there's a small population of patients where there is an autoimmune component to it. Linda says, I was curious, I have Hunners and IC. I always get UTIs. Do you think the open sores in the bladder can cause bacterial growth or cause embedded UTI? The open sores don't cause infection, but the open sores are basically opening the door to infection. As long as you have open wounds in your bladder, it's going to be very easy for bacteria to get exactly where you don't want it, which is down here. Amanda says, what if you don't have Hunner's lesions? Then we have to look at the other subtypes. Could you have estrogen atrophy? Could you have chemical injury to your bladder? Could you have a pelvic floor injury? Could you have a nerve injury? Amanda says, can we ever have regular coffee again? Amanda, it depends upon your subtype, hon. If you have active lesions, no. If you have estrogen atrophy, listen, even with estrogen therapy, you're never going to have a 20-year-old bladder again. You are always going to have a menopausal bladder. And the estrogen is helping a little bit, but you have to understand that your bladder's ability to defend itself is compromised. And it might not be able to take 1 cup of coffee a day. It might not. Hello, Caroline from England. Nice to see you, hon. Carrie says, I'm struggling with inflammatory arthritis and was started on sulfasalazine. I'm 3 days into 500 milligrams daily, and I think it's lighting up my bladder. Anyone have experience with that? Hon, let me look it up. Let me look it up on this computer because I got too much happening on this computer. Hold on a sec. Let's just take a look real quick. Sulfasalazine. All right, let's see what WebMD says on sulfasalazine. Stomach upset, nausea, vomiting, loss of appetite, headache, dizziness, unusual tiredness. Can cause your skin and urine to turn to orange or yellow. This is harmless. Tell your doctor right away if you have hearing changes, ringing in your ears, mental or mood changes, signs of kidney problems. Such change in the amount of urine, painful urination, or blood in your urine. A new lump or growth in your neck, numbness and tingling in the hands and feet, signs of low blood pressure, etc. Okay, so you need to call your doctor and let them know you're having urinary issues with it, okay, hon? Because it could be affecting your kidneys. Like I just started I have been on a new med for about 3 weeks now, and I'm just like waiting to see. I'm supposed to drink a lot of water. Kim says, you said coffee can set you back 2 weeks. Does that include chocolate, caffeine, and tomatoes? Yeah. But so the caffeine is like taking a jackhammer to the nerves, and the nerves are exposed. So why would you want to do that? The tomatoes are going to do it in a different way because that's acid erosion. Chocolate is neurostimulatory. Amanda says, I have Dandy Blend tea. What else do you add to make it a Frappuccino? I add ice, I add coconut milk, and a little bit of vanilla coconut milk. Caroline finally found an estrogen cream. Awesome. Cassandra said, I've been on the IC diet and I've still been struggling for 5 months in pain and going to the bathroom every 5 minutes. So, Cassandra, has anybody looked inside your bladder? And if they did, what did they find? Roberta says, new here, my partner has IC and has been prescribed insulin. He did the first instill last Monday. The recommended instill is 30 minutes to 2 hours. He couldn't hold it any longer than 30 minutes and was in a lot of pain, which persisted. He is supposed to do the next instill tomorrow and is worried if the insulin caused his pain. Okay. We have to have the Canada talk. I have the Canada talk every week with 1 or 2 new people. Listen, Canada healthcare sucks right now. It just sucks. It's years behind the rest of the world. Insulin, hyaluronic acid used to be called cystostat. And insulin is just a new variation of that. Roberta, do me a favor, and you need to have him watch our subtyping video on our website. Because I'm going to tell you right now, 90 to 95% of the guys who develop IC, we find physical injury or trauma to their pelvic floor as the underlying cause for all of their bladder symptoms. And I'm always available. I'd be happy to talk to him if you like. I work with guys every day. It's kind of my specialty, actually, is working with men with IC. I mean, I work with women, obviously. I work with women, but very few people also work with men. I'm one of those where I put men very high on my priority list because they don't get the support they need. Here, hold on a sec. I gotta. Oh, you guys. Oh, two things. My dad is going to be 100 years old on November 11th. Oops. Hi, Dad. Is she coming through? Okay. He's going to be 100 years old. And I am trying to get as many people as I can to send him a birthday card. Listen, he fought in World War II. He's a proud Navy veteran. He is the reason why the IC network is here, because when I could not function and I was bedbound, my parents took me in and cared for me. And I'm obviously caring for them now. And if you would help me by sending a birthday card to him, that would be great. I actually rented a P.O. box for it. So I have a box now for it. And I will, let's see. I can't put it in Facebook right away because I'm going to lose it. If you email me, icnetwork@mac.com, icnetwork@mac.com, I will email you our mailing address for this. 100 years old. I've saved his life twice in the last 20 years. And it's not just a celebration of him, it's a celebration of me caring for him, really. I mean, in that way, I'm really proud of that. I'm really, really proud that we've gotten him to 100 years old. Okay. So please email me, icnetwork@mac.com. I will try to post on Facebook, and Twitter and Instagram, if I can, the box. I would just really, I just want him to have like 100 cards to open that day. And we've gotten a couple so far. Okay, and the other big thing is an unboxing. Look what we finally have. We finally have pre-leaf sterins. So the oldest supplement, for those of you here that's on Facebook and YouTube, the oldest supplement that's ever been used by IC patients, this is going on 35 years, is pre-leaf. Pre-leaf is an acid reducer. It does nothing for your bladder wall. All it does is it removes the residual acid in the food so that by the time it gets to your bladder, it doesn't irritate your bladder. And so years ago, we had pre-leaf granular, just poured into a cup of coffee. You were good to go. But with the change of ownership and everything, they discontinued that, but now it's back. Everybody wants pre-leaf sterins. We just got our first case. It's sitting in my car, as a matter of fact, because it got sent to me instead of my warehouse. I will have this in the IC Network store sooner rather than later. And they sent me 12 boxes, and these are big boxes. And so if you would like some samples, I will mail some to you. And I'm not talking just one packet. I'll mail you a bunch because they sent me a bunch. So my email address, icnetwork@mac.com. If you want some pre-leaf sterin samples, email me and I will send them to you. Okay, hold on. I got to check on my mom. Hold on. Give me one quick moment. How are we doing? I'm doing my support group meeting. Your breakfast is on the table. It might be a little cold. I'm doing my meeting right now. Yeah. I just want to get your hair up into a ponytail. So your coffee's there, your tea's there. I mean, your tea's there, your juice is there, your cereal. Everything is there but fruit. The fruit's in the fridge. Okay? Let me Okay, I hurt my neck is very tight. As you're gonna walk. No, not yet. It's cold outside and I'm doing my meeting. If I walk, I'll walk later. Okay. You're good. Okay? All right. Sorry, I had to put her hair in a ponytail and put her hearing aid in. She's 93 and she's very, very frail. Very, very frail. Oh, one reason why I'm just like so stressed all the time. You ever wake up anxious? Like yesterday, I had a really good dream right before I woke up. This morning, I woke up anxious again. It's just a lot of life is hard right now. Cindy said, okay, which subtype is it when all the females in my family have symptoms? It's probably subtype 5, central sensitization. It means that you're born with more sensitive nerves. That's true in my family too. Cindy said, I seem to be IC subtype 3 and 5. Yeah, some subtype 5 happens because of genetics, but subtype 5 can also happen after injury and or trauma. The central nervous system takes the brunt of injury. So we know 14 days of pain, 21 days of bullying or abuse can change that central nervous system. Oh, and I should say, by the way, you should on Twitter, for those of you on Twitter, hopefully you're following me on Twitter. I'm Icy and Jill on Twitter. But you know who you really also need to sponsor, you need to follow is Stephanie Prendergast. Stephanie Prendergast may be the best physical therapist in the world for IC. She may be. She's a former president of the International Pelvic Pain Society. And she is one of the founders of the Pelvic Health and Rehabilitation Physical Therapy Clinics, which are in California. They're in back east. I mean, they're just slowly growing. She's fabulous. Their blogs are insane. They are so good. Like, I mean, I think our blogs are pretty good and they're better than ours. And she lets me reprint a lot of their stuff. And so she just did a blog on pelvic neuralgias. And this is interesting. This is very, very interesting because I, for example, have had pain around my left sit bone for decades, right? Okay, so she actually goes over that. A genitofemoral neuralgia is manifested as pain in front of the thigh and pain in the genitals. That's a femoral nerve. An obturator neuralgia is pain in the inner thighs. And ilioinguinal neuralgia is pain in the groin, lower abdomen, base of the penis, or the labia. Peristatic neuralgia is pain on the outside of the thigh. And posterior femoral cutaneous neuralgia, which is what I have, is pain in the perineum and pain around the sit bones and pain in the back of the thigh. So her Twitter handle is @Pelvic Health. Please follow her. She's insanely good. That whole clinic is amazing. Carrie said, okay, here, hold on a sec. Elena says, I took 20 sessions of hyperbaric oxygen in August. I feel better than when I started. No discomfort after urination. No need for Valium. I felt I could actually live like that. My IC is bladder wall driven. When I came back home, a horrible flare started after 1 week. I did a urine culture. We asked the lab to look for bacteria under the standard level. It got back with less than 1,000 Enterococcus faecalis. I can never pronounce that. Faecalis. Faecalis. Since my symptoms were so bad and unusual, I got antibiotics. The worst symptoms reacted to the antibiotics. Also had a very bad flare in July. When we cultured, it showed 10,000 of another. Doesn't sound like coincidence. Each time I get horrible flares with unusually brutal. Oh, dang it. All right. The feed just moved, hon. I can't go back and read it. No. Okay. I couldn't get to the end of your thing. I'm sorry. Please ask your question again. Carrie said the Elmeron install worked better. Good. Cindy said she's in Canada. She does cystostat installations. Very helpful. Good. I actually thought cystostat ended up, I thought they ended up pulling it off the market. John said, are the pre-filled syringes still available for installation? Some pharmaceutical companies, no. Some pharmacies, compounding pharmacies may have pre-filled syringes. But you might be referring to an old program that got canceled, and I don't even remember the name. It was a pharmacy down in San Diego that had the licensing rights for the Parsons solution, and they had pre-filled syringes that they sent to people. But they gave it up years ago. Lori says, my urologist believes infection destroyed the inner lining of your bladder. Infection is very, very damaging. Infection basically creates tunnels. So if we think, again, this is a really good model here because you can see the cells. So let's just say this cell gets infected and it becomes a bacteria factory. It ruptures, releases all these new bacteria who then affect nearby cells, and they affect nearby cells and nearby cells. So you kind of end up with tunnels throughout your bladder wall with infection. But see, the thing is healing is always happening, hon. Lori, that's the part that I just can't really get on board with because healing never stops. Your body is hardwired to repair damage. So once that infection is completely gone, your bladder should be healing. It is healing. That never turns off. It might slow down, but we have no evidence that healing stops in the bladder. Elena says, here's an interesting Swedish study about the immune modulation drug. One of the best IC researchers in the world is in Sweden. His name is Magnus Fall. I had a very brief conversation with him at a conference. This is quite interesting because this was after the Europeans released their guidelines for IC, and the European guidelines for IC require a hydrodistension with biopsy in every single patient. And of course, that's never going to happen in the United States. The United States is very different. We don't want to traumatize patients further. And our insurance companies aren't necessarily going to pay for a hydrodistension with biopsy. And so I remember I went up to him in a poster session at an NIH meeting and tried to talk to him about that. And I said, the problem with the guidelines is it's just not going to happen in the US. And he was shorter than me, but he's a big, powerful presence, right? And so he actually kind of looked down at me and said something like, well, isn't that a shame? Very dismissive of American healthcare. I would say he's a very nice guy. I would listen to him at any moment of time. He really knows stuff, and I'm Swedish, but we just didn't hit it off particularly well. He will be speaking tomorrow at the conference. Becky says there's low acid coffee like Tyler's. Yeah, there is. Tyler's makes low acid coffee. Simpatico makes low acid coffee. My favorite low acid coffee is Bella Rosa low acid coffee. Bella Rosa has the lowest acid levels of all the coffees out there, proven by research at UC Davis. And it tastes really good. We have it in the IC Network store, but I would then argue that if you had an open wound on your hand, would you pour low acid coffee on it? Or would you pour coffee with pre-leaf on an open wound? And the answer is no, not really. You probably shouldn't. You got to wait until you're feeling better and give your bladder an opportunity to heal. I think it's important to be off of coffee for like 6 months. And then when you're ready to try it again, you got to do our coffee challenge. So our coffee challenge, hi Denise, hi Lori, hi Goodwill. Okay, so when you're ready to consider trying coffee, you want to do the ICN coffee challenge first. So the first thing is, how are you with hot water? If you're good with hot water, you're good. The second test is, how are you with hot chamomile or hot peppermint tea? If that doesn't flare you, you're good to go. Your next step is going to be a roasted herbal tea, like a rooibos tea. Rooibos tea is a brown grain tea. It's quite good. We have some in our store. We have pumpkin spice rooibos tea that's insanely good. I love it. So it's very mild. There's no acid in it, or very, 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 very low acid. So we would then say, okay, try the rooibos tea, see how you do. Do I even have it here? Oh, look, I do. So this is, it's from Harney and Sons, rooibos tea. And this is pumpkin spice, but it doesn't taste like pumpkin spice. It just tastes like caramel. It's really good with a little bit of cream, a little bit of sugar. You can't go wrong with this on a cold, frosty morning. Okay, so try a rooibos tea. See how you do. If you do okay with the rooibos tea, then you go to the herbal coffees. And the herbal coffees are going to be Dandy Blend. So Dandy Blend is solid. Ticino, I find Ticino very bitter. We used to sell it. I just personally never liked it. There's a couple of different herbal coffees out there. I think Dandy Blend is the best herbal coffee. It's the mildest herbal coffee. Thank you, Linda, for the 530 stars. Much appreciated. Very, very much. If you do okay with the herbal coffee, then you're going to try a low acid real coffee. And let's see. Okay. These are the ones that we suggest. Of course, I think Bella Rosa is outstanding. And the nice thing about the Bella Rosa brand is that they make a decaf, they make a half calf, and they make a full calf. And so if you are completely addicted to caffeine and you get that headache, their half calf is a really good transition point. It's going to reduce some of the irritation to the nerves in your bladder, but still give you what you need to prevent the headache. And of course, we have Simpatico. We've sold Simpatico for 25 years. I mean, we've had this forever. It's a popular favorite. And then, of course, we have Tyler's no acid coffee also. He says no acid, but the one research study that I saw, and Tyler's great. And Tyler is a wonderful, wonderful young man. I think he's doing a great, great job. It still has a little bit of acid in it. Its pH is not 7. Its pH is like 6.2, somewhere in there. But anyway, Bella Rosa, Tyler's, Simpatico. Do I think, are you ever going to be able to drink a big, strong, hot cup of something from Starbucks? Probably not. especially if you're older and you have estrogen atrophy or you have an injury of some type to your bladder wall. I think that it would be a mistake to do that. We have lots and lots of options now. So that's the coffee challenge. That's how you determine if you're going to be ready for coffee or not. Cassandra said, and Cassandra, I apologize. I've got lots of distractions here. The doctor won't put you on Urel. He said he won't go in there. So I'm trying to find a different urologist. I'm on Tylenol. Somebody was asking on YouTube or here on Instagram how to find a good doctor. We have a database right on our website, guys. It's completely updated. Thanks to Angie, who updated it for us. icnetwork.org's right in the main menu. Find a doctor. That'll help you find a doctor in your area. And there's also a fabulous website for physical therapists called pelvicrehab.com. And Cassandra, the thing is you don't get caught up in chasing the symptoms. I know you're in pain right now. We have all had those moments where we've had terrible pain and frequency, and you're just like grabbing at straws. Help me, help me, help me, help me. And that's normal. But you always have to have a hard look at causation. Cause versus effect. These symptoms are the effect. We have to understand the underlying cause. What is driving this? Becky says, I found this podcast by female urologist Kelly Casperson called You Are Not Broken. It's so good. It's about women's sexual dysfunction, menopause, and estrogen cream. I got to write that down. Hold on. Kelly Casperson. You know, I almost started a podcast 5 or 6 years ago, Living with IC podcast. I just didn't have time to do it. I still have that domain, I think. You're getting a live podcast instead. All right, Marisol, if you want samples for pre-leaf sterins, you have to email me, icnetwork@mac.com. Mail me your mailing address. And I haven't sent any of them out yet. We did this 2 weeks ago to you guys. I haven't had a chance. I'll probably be addressing all of your envelopes tomorrow morning at 5 or 6 a.m. as I'm listening to this conference. icnetwork@mac.com. Thank you, Sarah. Sarah said, I've been wondering if I have nerve damage and pelvic muscular injuries both. What subtype is that? 3 and 4. I ask, can constipation cause frequency? Sure. You know, every IC patient has, well, no, that's wrong. Many IC patients report that when they are constipated, their symptoms are worse. What's the name on Instagram? IC Network. Elena says, I took 20 sessions. Oh, there you are. Oh, it came back. Okay, hold on. That's the thing about Facebook. Could the cause of my disease be some overreaction of my immune system to small numbers of pathogenic bacteria? Girl, what an incredibly good question. I don't think we have the data to know that, Elena. I mean, usually IC patients are negative. Okay, we usually don't have active infection like you're having. You know, for everybody out there who are getting infections, it is very, very important that you don't just accept infection. You got to ask them, what type of infection is it? You have to track it. Is it E. coli? Is it strep? Is it enterococcus? Is it micrococcus? Write it down. Because if you're getting the same bacteria over and over and over again, then that means you may have a super drug resistant infection. Or you may have something in your daily life that is constantly inoculating you, like bath judge. Okay, here on Instagram, I've got a counter, 30 seconds remaining. I don't know what that means. You guys, I'm sorry, I don't know what that means. Does that mean we only have 20 seconds left? Probably. Instagram, I will start it up again if they let me. I don't know what's going to happen in 15 seconds. You guys, you get it. Okay, so getting back to my point, track the bacteria. If it's the same bacteria over and over and over again, you have a drug-resistant infection. Okay, the live video just ended. Okay. Okay. Hold on. Our latest IT support meeting. I hate typing on my phone. Okay, if it's a different bacteria every time, that says something about your immune system. And we have to look at your immune system and try to understand why your system is so vulnerable to infection. Okay. Okay, hold on. Okay, hold on. Instagram, I'm trying to figure it out. All right, so now on Instagram. Hold on. What? All right. Okay. Okay. Sorry, you guys. I am trying to stream on 3 platforms simultaneously. We're streaming on YouTube, we're streaming on Facebook, and we're streaming on Instagram. All right. Well, Instagram's just going to have to hold. Okay. Let me keep going. So again, if you have lots of different types of infection, then we have to look at your immune system. Listen, and if you have infection over and over and over again, especially the same bacteria, you've got to do next generation DNA testing, because that will identify and isolate drug resistance genes. That will really give us a very pathway, because it will tell us, that's the cool testing is they look for DNA. They get these massive databases and they're able to track the minute details on what that specific strain is resistant to. It's fascinating. I was working with a patient a couple weeks ago. She had probably the most drug-resistant E. coli bladder infection I personally have witnessed. She was drug-resistant to 13 antibiotics. There were only like 4 that would kill it. Casa says, "Oh, hi, Alexandra. Can you explain to me what amitriptyline does? Is it for nerve or musculoskeletal pain?" It's for pain. A low dose antidepressant can calm nerves down over time. It's not a pain medicine. It instead kind of calms the nervous system down, and it works slowly over time. So generally, you don't take more when you're in more pain. In fact, some patients have overdosed on amitriptyline when they've tried to do that. Instead, you're meant to take a little bit at a time over time to try to help calm those nerves down. The problem with amitriptyline are the side effects. It's massive side effects: dry mouth, dry eyes, weight gain, makes you crave carbs. We call it the Eleville 20. When I did amitriptyline for just 3 months, I gained 20 pounds. And thankfully, I lost those 20 pounds as soon as I stopped it. Our biggest concern about amitriptyline is that it can affect your heart, which it did for me. It can change the conductivity of your heart muscle, which it did for me, which I still suffer with today. Or if you take it every day for a period of time, it is strongly linked now to dementia. If you take it every day for 3 years, so it's like if I remember correctly, the research, like a 50% increase in your risk of dementia. And they wasn't just in older people, they were seeing it in young people under the age of 30 also. So amitriptyline is a challenging med. Cindy, thank you for telling me that it's back. I had no idea. Larian said, I had breast lumpectomy surgery for breast cancer last Friday. Oh, Larian, big giant hug for you. I'm so sorry. I'm glad you're through it. Before surgery, you were pain-free for months. I can't get this flare to calm down. I've tried Urabel, muscle relaxer, ice heat, Tylenol, put all the meds they gave me during surgery. It says yes. Yes, some of the medications certainly could have irritated your bladder. And, you know, a catheter could have triggered things too. It's fairly normal to have like when I had my hysterectomy, I'm going to say it took 6 weeks for my nerves to all finally calm down a bit. Everything got very agitated. So it wouldn't surprise me if your central nervous system is much more agitated now. John said, when I first started instills, I had to go to the hospital each time. I eventually was successful in getting insurance to let me do it at home. Yes. The last time I could only have it done at the hospital. Currently, how successful are people in getting insurance to allow home instills? It's getting harder and harder, John. I don't know why, but I was working with somebody last week or the week before who they would not authorize home installations, and I thought it was ridiculous. I don't understand why. All right, let's check YouTube here. All right, and okay, Instagram. I don't know what the hell's going on with you. Okay. It doesn't look like Instagram's going to let me go live. No. No. They must have a limit on it. So sorry. Okay. Priscilla, how do you deal with an IBS flare? As I'm suffering with it along with IC, I've emailed you asking for your address. My husband is Canada. Oh, thank you, hon. My dad's name is Jack Osborne. Really easy. Jack and Jill. We are Jack and Jill. We were actually a really successful mixed doubles tennis team for many years as Jack and Jill. People dreaded seeing us. We were tough. We have a lot of trophies. It was great. So how do you deal with an IBS flare? So with IBS flares, you know, again, it's about calming the nerves. It's about understanding that the nerves that's IC subtype 5, central sensitization. It means the nerves in your bladder, the nerves in your bowel, the nerves in your skin, the nerves in your smell, the nerves in your brain. I mean, your sense of smell, the nerves in your brain are more sensitive. And so we have to understand the things that can trigger that, like anything that's neurostimulatory, like caffeine and chocolate. Man, back when my IBS used to be really bad, I had bend over and scream or bowel spasms after eating chocolate and oatmeal. It's also about trying to figure out, for Sid, the foods that really bother you. There's a fabulous website, helpforibs.com. Heather started that when I started the IC Network. We're peers, we're friends. But we went in different directions. She ended up creating some wonderful products for patients with IBS, like her tummy fiber, which is what I use every day. So go over to Help for IBS and take a look at her diet information, because the IC and the IBS diet are very similar. They're very, very similar. It's about avoiding things which can trigger the nerves in your bowel and your stomach. And getting that fiber in there, you need a good, healthy source of fiber. And acacia fiber is the best fiber for patients with IBS because our nerves are so sensitive. We do not do well with psyllium husk. We do not do well with Metamucil. We do terribly with granola and bran cereals. They're too rough, caustic, and aggressive. One of the things she taught me when she appeared in our lecture series is you never start a meal with a salad. Never. And I used to have IBS flares all the time after eating salad. I would go, I mean, this is in my 20s. I would go out to lunch with my girlfriends. What would we do? We'd have a Cobb salad. Well, 45 minutes later, I'd be in the bathroom with agonizing spasms in the runs. Why? You know, I mean, like, why? And she explained that because the nerves in our bowel are so sensitive, you never want to start a meal with something that's provocative. And lettuce is provocative. Lettuce has sharp edges. I know it doesn't feel sharp to you. Think about granola. Granola really feels sharp, but lettuce is actually sharp also. And that's insoluble fiber. That's fiber that does not dissolve in water. And she explained, no, we need soluble fiber. We need fiber that dissolves easily. So the perfect way to start a meal is instead with a cup of split pea soup or butternut squash soup or pumpkin soup. And so it may be the fiber that you're eating, if you are eating fiber, is just too rough for you. Also remember, you need to have 20 to 25 grams of fiber a day. As a woman, 25 to 30 as a man. And you want that fiber to be sourced with soluble fibers like green peas, things like that. What have I eaten today so far? I've only had I've had 3 grams of, no, because I put, did I? I didn't put acacia in this, darn it. I've only had 3 grams of fiber a day so far. So I'm going to have split pea soup or something tonight to really get that fiber content up. Amanda says, is the coffee challenge written down? Yeah, it's over on the IC Network website. Chantel says, do you do individual consultations every single day? You can sign up for wellness coaching. If you just have a question or two, you're welcome to call our 800 number and go to the last extension, which is our patient support line. I answer that, and I'm happy to take a couple of questions. No, absolutely no charge, not a problem. 95% of what I do is free. But if you want to spend a long time talking about what you're doing, 30 minutes to an hour, then it would be good if you signed up for coaching. Or what I often say at the end of those meetings is, if we're just talking on the phone and I talk forever because I can, is I just say, if you find this helpful, please consider becoming a member of the IC Network or buying something in our shop. Becky says, we love your videos. Oh, good. I'm glad. Kayleen said, hey, Kayleen, how you doing, girl? Finally got my Mirba trick, but the side effects are so bad. Really? Oh, man, I'm sorry to hear that. Can you lower the dose? You may just be like me. You're so sensitive. Maybe they just gave you too strong of a dose. You can call the doc. You can call the doc and ask. I don't know what match.com is. Cassandra said, thank you very much for the IC Network. I'll go in there a bit. Cool. Kayleen says she's constipated from the Mirba trick too. All right. Girl, seriously, don't you just, it is so frustrating. Can we just all please have 6 months where there's no health issues, right? Please, God, in 2023, can we just calm everything down? I would like for everybody to have at least 6 months with nothing going on, because 2022 has been way too stressful for all of us. Elena says she had the microgen test. It showed enterococcus. Enterococcus is rough. Enterococcus facialis is a really difficult infection that they're studying. Kayleen said, I did have a light beer at my cousin's weddings last night, and you got up twice to pee. That I expected, but at least I didn't get drunk, and I only drank water. Yes. So remember, for those of you who are gonna have a beer, you got to do a very, very pale ale. Do not do a dark porter or a brown beer. Do a pale ale. That's what our research showed was more bladder friendly. And chase it with water. Do some pre-leaf. I understand. I tend to go for cider, hard cider myself. I really like berry cider, but I cut way back on alcohol. I've never been a big drinker. At the most, I would have 1, maybe 2. But we have a family member who's having some liver issues, and so it's like, all right, just in case I inherited some liver stuff, I'm just going to stop the wine and stop the beer and start. I've had 1 hard cider in 6 months. I'm just trying to up my physical health. I am taking responsibility for Jill Osborne's body. And I'm also learning that I am a stress eater. I was reading something this week and it said, ask yourself when you're eating, are you actually hungry? And after dinner, when I'm craving something sugar, I am not hungry and I eat it anyway. That's what I'm trying to stop. So annoying. Jadira says, in my urine microgen test, it was 43% E. coli. The treatment is to take antibiotics for 1 year. I'm going to start with amoxicillin. Is this an effective treatment? What is the consequence to taking antibiotics for a long period of time? All right, Jadira, outstanding question. Yeah, so what is going to tell us if amoxicillin is effective are your next gen test results. So when you had the microgen test, it should have given you a list of the antibiotics that would kill it. So as long as amoxicillin is on that identifiable list, you should be good. You should be good. What are the consequences to taking long-term antibiotics over time? That is huge because antibiotics are, think about a tropical forest, right? You've got lots of diverse trees and wildlife. You've got birds, you've got flowers, you've got animals, everything. And you've got nematodes and earthworms underneath the soil, et cetera, et cetera. You've got this beautiful, robust tropical forest. And just as we have a beautiful, robust urinary biome, that your urine is not sterile, your bladder has important beneficial bacteria in it that play important roles in bladder health. So, and taking an antibiotic is like taking a flamethrower to the tropical forest. It can kill pretty much everything. It will wipe it out. And the only things that will survive are going to be things that are resistant to the antibiotic, like a drug-resistant E. coli infection. So now we have just wiped out the entire urinary biome. The bacteria that normally prevent fungal growth are potentially going to now prosper. And so one risk is the development of yeast infections, candida infections. And guys, make no mistake, systemic candida infections can be fatal. They're a big problem, and many of them are drug resistant now. It also destroys the normal balance between good bacteria and bad bacteria. So now bad bacteria have the ability to flourish. And that's where you can get C. diff. If you've taken antibiotics and a month or two after you stop them, you have bloody diarrhea, well, that's C. diff. So now you've got to take more antibiotics to kill the bacterial overgrowth of the C. diff. And the longer you take the antibiotics, the more you create the perfect environment for super, super drug-resistant bacteria to prosper. So each round of antibiotics then self-selects out the strongest drug-resistant infections over and over and over. So at the end of that year, you could have some wickedly strong E. coli in there. So hospitals around the world now do something called an antibiotic stewardship programs. We understand that the reason why there are so many drug-resistant infections out in the world are because of the massive overuse of antibiotics. Then there's no clearer example of that than India, because in India, antibiotics are over the counter. And India has some of the highest drug-resistant rates in the world. If you've gone to, there have been many cases of tourists who have been injured in India. They come home with these super, super drug-resistant infections that are very, very difficult to treat. So the guy who won the Nobel Prize for inventing the antibiotic predicted this would happen. And he's in his Nobel Prize speech in the 40s, he said this would happen. And he was right. This is exactly what has happened, this rise in drug-resistant infections. I just saw late last week a discussion about making antibiotics over the counter here in the United States. And I think that that is a terrible idea. It's a terrible idea. You know, we get so used to, think about the typical IC patient. You have all the symptoms of frequency, urgency, pressure, pain. You're convinced you have an antibiotic, just like so many of us were convinced that we had yeast infections. So what did we do? We bought millions of boxes of Monistat. They never worked. Well, how many of you during flares, you're going to say, just to be safe, you're going to go down to the drugstore and buy over-the-counter antibiotics, not understanding the tremendous damage that that could do to your overall urinary biome and your whole body biome. Alexis says, my physiotherapist did find weakened muscles. That's why I wonder if being on amitriptyline is even beneficial for me. I think that we have to go. So if we look at the treatment protocol in the brand new AUA guidelines, there are 2 recommendations. The rest are options. Recommendation number 1, if a patient has Hunner's lesions, treat them immediately. Don't send them home without proper treatment, because they will suffer from pain until they get treated. And number 2, if a patient has tight pelvic floor muscles, please send them immediately to pelvic floor physical therapy, because pelvic floor physical therapy works and works well. I should know. I've done it many times. I swear by it. Okay. Elavil, amitriptyline, Elmeron, hydroxyzine, those are options. They're not recommendations anymore. They're options. And so I think the way I would interpret the AUA guidelines is what they say is, okay, do the physical therapy first. That is an immediate referral. Shannon, I had a bad flare-up yesterday. I rested, used my heating pad, ice between my legs, drank baking soda water, did my pelvic floor. Today I feel better. Yes! Excellent. Good job. I had a flare yesterday too. I had a flare day before yesterday. My muscles just got tighter and tighter and tighter over the week, and I didn't do anything about it. And then finally my rectum started burning on Thursday, and I went, uh-oh, I better get out my wand. And hold on a second. We got a sex spammer on YouTube in our YouTube channel. Let me ban this guy. Hold on. All right. Shannon says, is pumpkin seed oil capsules good for IC in the bladder? I saw a lady recommended it. Pumpkin seed has really only been studied with prostatitis. It was found to be particularly helpful, which is why some of those prostate supplements do have pumpkin seed oil. I do not believe that we have a pumpkin seed oil IC study. Let me look. We've been talking, and patients have been talking about it on the IC Network forum since 2015. Here's somebody who said, I started on pumpkin seed oil after doing some research. All I can say so far is I highly recommend giving it a try. I mean, it's benign. I love pumpkin. But I'm not seeing any research. I see an overactive bladder study. Hold on. Let's see what that is. Pumpkin seed oil extracted improves urinary disorder in human overactive bladder. The pumpkin seed oil obtained from pumpkins has been shown to be useful in the treatment of nocturia in patients with urinary disorders in several Western countries. In this study, we evaluated the effect of pumpkin seed oil on urinary dysfunction in human overactive bladder. 45 subjects were enrolled in the study. They took it for 12 weeks. After 6 and 12 weeks, function was evaluated. It significantly reduced the degree of overactive bladder symptoms. The results from our study suggest pumpkin seed oil are effective for urinary disorders such as overactive bladder. I got no problems trying that. You know, that. Let's see if there are any side effects. can't imagine side effects unless you're allergic. Let's see. Side effects from pumpkin products are rare. This is from WebMD, but might include stomach discomfort, diarrhea, and nausea. It might also cause itching, rash, and allergic reactions in some people. High in vitamin K and omega fatty acids. I like pumpkin seeds. All right, hold on. Sorry, YouTube, I didn't realize that that picture wasn't good. All right. Becky says, I was on macrobid for a year. It messed up my microbiome and my digestive system and vagina. Becky says, good for you, Jill. I stopped drinking 12 years ago before I was diagnosed with IC, and I do not miss alcohol at all. My life is a lot happier. Yeah, I don't miss it either. I mean, like on a Friday night after a long week, that's usually when I would have a hard cider. But I'm very determined to protect this body now. Loretta says, IBS triggers fat, dairy, red meats, pork, caffeine, wheat, and other grains. I do a I don't know what STAIR is, and you compare it with the IC and IBS diet, it can be limiting. Kim says, how long does it take physical therapy to work? Man, girl, that is an outstanding question. So physical therapy, so this is something every patient needs to understand, that the goal of physical therapy is to get your pelvic floor muscles long and loose and pliant. A healthy muscle feels like a raw chicken breast. It's smooth, it's soft, you can push on it, right? A tight muscle, I mean, it's palpable. You can really push into a muscle. I mean, like, right? Like that's good muscle tone right there. A pop muscle, and of course I'm wearing the wrong shirt and I don't have big biceps anymore. Is hard to touch, right? You can't really push into it. And the problem with that tension is that the muscles are wrapped around a lot of blood vessels and nerves. And so now we have hard, tight muscles squeezing blood vessels and nerves, and that's not good, right? So when you're doing physical therapy, what they're going to do is they're basically going to go the length of the muscle, right? And they're just, because a hard muscle is tight. And so what they try to do, and this is not symbolically perfect, but generally what they would do is use their fingers and just try to slowly get the muscle to flatten and get it soft again, right? A super, super tight muscle feels like beef jerky. It's hard and painful. So, and you as a patient, you can tell how your muscles are based upon how you're peeing. Like for me last week, I just could tell, I could see that I was stopping and starting, and my urine stream wasn't good, and I wasn't releasing urine very quickly. Telltale signs that my muscles were getting tight. Did I act on it? No. And then it got really bad, and then I started having a lot of glute pain, and then I started having rectal pain. And it was sharp pain. It was like nerve pain. It's like, okay, I know exactly what this is. Went and got my, middle of the day on Thursday, went and got my wand, dropped my pants, got some KY, and I did with my glass wand some internal work. And so what was really interesting about the internal work this time for me, because why do our muscles get tight? In many cases, our muscles get tight from sitting for a long period of time. So this is your pelvis, and your tailbone is in the middle. So this is kind of like from the side, right? But we're looking at it up. So I was really surprised for me this time that I had on my left side, no problem going very deep. It was very soft, pliable. Where it was tight was right around my tailbone. And it was tight. And then I went over to the right side, and the right side had lifted and it was very rough. So this side was long and loose. This side was locked down hard. So again, I used my wand, took about 5 minutes, got this to calm down. And as I was feeling the tension, all the tension was very low. By the end of that 5 minutes, it was just right around the rectum, right around the urethra. And so I was really using the wand. And this is a good way to describe it. I mean, that's how I was using the wand. I was going with very firm steps right along the ridges of tight muscles. And it worked. And I don't have all the rectal pain went away. But if I sit too long, or if I don't pay attention, it's going to come back, not a disease, trauma. And then the other question you've got to ask your physical therapist, and the single most important question, and ask your physical therapist over time, is, are my muscles staying relaxed or are they going back into tension? Because if they're going back into tension every single time, a day, a week, a month later, and you're stuck with chronic tension, like a patient that I was working with last week or the week before, I asked her, is sex comfortable? She said, no, it's always been painful. Her entire life, sex has been painful because for her entire life, her muscles have been tight. Now we have to figure out why. Sometimes it's one leg longer than the other. Sometimes it's trauma. It could be abuse. It could be something as simple as an uneducated parent hitting you if you were incontinent. If you were a bedwetter, there are some parents who beat their children because they wet the bed. And so that child doesn't want to get beaten. And so what do they start doing? They start subconsciously tightening their pelvic floor. And they never learn how to relax it. And so by the time that child's in their 30s or 40s, their muscles are locked down hard as a drum. And so we have to go in and we have to teach them the way your muscles are supposed to feel. Sex is not supposed to hurt. And of course, we look at bones. If you have scoliosis, we have something called scoliosis-driven pelvic pain. And that's because your pelvis isn't quite centered. You got one higher than the other, maybe one rotated or the other. If you have a tailbone injury, that's going to tweak your pelvic floor. If you've had a baby and you had suffered a tear and you have scar tissue, or if you had pelvic surgery of some type, like a hernia repair, or some maybe for endometriosis, something like that, that's all going to leave scar tissue, which is going to affect your pelvic floor. So physical therapy is not a one and done. If it's a simple case, maybe 6 or 8 treatments of physical therapy might get your muscles back down to good muscle memory, where they remember that they're supposed to be relaxed. But if you have another pre-existing issue, like an SI joint issue, a hip issue, scoliosis, or et cetera, then we have to work on those muscles for the long term. And at the same time, try to figure out what's wrong with the bones and if we can fix the bones. And again, I was working with a patient this week, and we were going through the subtypes, and she shared that she had hip pain. That's a giant clue. That she had hip pain on one side, and then it went over to the other side. That's musculoskeletal. Was that affecting her pelvic floor? 100%, absolutely. We've got to understand, as I said to her, what's going on with her hip to try to figure out how that's affecting her pelvic floor. Shannon said, worked right away for me. You need to make sure you do your exercises every day. Girl, that's where I fall short. It is so important to do your exercise. I mean, having that, this is where I fall short. I should have a routine every morning. I should be getting up early. I should do my internal work. I should do my stretches. Then I should get out and walk. And I suck at that. My consistency is terrible. I just get so distracted. I've been walking every day, but that's not enough. Anne says, I've used pumpkin seed gel pills for several years, and it really helps my frequency. I only get up around 6 a.m. to go to the bathroom. I can really tell the difference when I don't take it. Good. Kim says, yes, I have scar tissue from childbirth. You know what? I got to call my supplier and see if I can get in pumpkin seed oil in the IC Network shop. Okay, please remember, if you want free samples of pre-leaf stir-ins, or if you would be so generous as to send a birthday card to my dad, who is turning 100 years old in 3 weeks. Yes. I can't believe we've made it this far. Please send me an email, icnetwork@mac.com, and I will email you an address. And please, if you can, spread the word. 20 years I've been providing care for him. 20 years. Shannon says, I've been doing breathing exercises, but it's so hard to keep up. I drive a lot for work. Yeah, that's a challenge. I did get a new, for those of us who have pudendal neuralgia, or we have a sensitive rectum or a sensitive vulva, sensitive perineum, sensitive testicles, etc., there's a very good cushion. This is the new one that they just sent me. This is this is kind of a vinyl fabric that's easier to clean. We don't have the vinyl fabric in our store. We have the blue fabric. But what makes these cushions so effective is the groove down the middle. So when you sit on it, each butt cheek is supported, but nothing is touching your testicles. Nothing is touching your vulva. Nothing is touching your rectum or your urethra. This is the single most effective cushion design for patients who have pelvic pain, pins and needles, pudendal neuralgia, anything at all like that. This is very similar to the cushion that we sold for 20 years. We had cushions that were made specifically for us. We've sold thousands of them over the years. The COVID shut the factory down, and we cannot get those cushions anymore. They used to be just $32. The factory's gone. It's gone. And so the closest we have is this cushion from Pelvic Pain Solutions, and unfortunately, it is more expensive. It's in the $70 to $80 range, but it's way better than the old cushion that we sold. Much better foam, much better design, much better fabric. It's got handles. You can carry it with you. Totally looks cool. Nobody would ever laugh at you for carrying this if you were going to a concert or whatever. So that's what I'm sitting on. Feels good. I love it. I love it. Mary says, my pelvic floor physical therapist says my ribs are compacted. So you're having massage from her at home and you do stretching. Good. Apparently the compacted skeleton can affect the pelvic muscles. Yes. And I had a sweetest little apple doll of an elderly woman who was in my support group years ago. And she's long passed away. She was diagnosed with something called stiff body syndrome, where all the muscles in her body locked down hard, and she used to shuffle into our meetings. Oh, she was the sweetest woman. And I do think it was this was before we really understood the muscles. And I'm sure that she just had very, very, very tight contracted pelvic floor muscles. What day is my dad's birthday? It's Veterans Day. Veterans Day. November 11th. That's when he was born. It's always easy to remember his birthday. And I don't know if we're going to be able to have a family gathering. I just don't know. I mean, because he's unvaccinated. He refused vaccination. And we have, little great grandkids who have been sick as a dog with cold after cold after cold this year. I hope we're going to be able to get together. I hope the weather's warm so we can be outside. If we can do it outside, that would be great. What he wants to do on his birthday is go see his doctor to have a physical. He had one in June. But if that's what he wants for his birthday, that's what he gets for his birthday. Any suggestions for a good bike seat? Yeah. The bike seat that you want is, you want to get one of the, it looks like two round circles. And so it supports your butt cheek. You sit on it, but nothing is pushing up against your tender bits. You're just literally, your sit bones are sitting on two round circles. That is the best bike seat. I don't know the brand name for it. Mary said you need one for the Seahawks games. Yeah, this one would be perfect. All right. Somebody did a stinker. Hold on. I got to go turn the fan on. Yep. Oh, the joys of living with a sensitive sense of smell. You smell, and especially with the bathrooms literally right next door. Hi, Rocky. Pete. Your cane is in the bathroom.
Huh?
Your cane, you left your cane in the bathroom. Your cane. And shut the door when you can, yeah. All right, you guys, you got any more questions for me? Alexa, love the realness of your live videos, girl. You know, it's interesting because I was talking to somebody a couple of weeks ago, and they were like, why do you do the internet stuff? Do you want to be a star? And I'm like, no, I'm just a support group leader. I like being a support group leader. It makes me feel like my life has purpose, that I'm doing something. And I just, the gift of being older is like, I don't need to hide anything. I care for my parents every single day. It is a hard, difficult job. It is part of me. And you guys are going to see me through when I lose them, because I'm going to be right here asking for your help and your support, right? And for anybody who's walked this walk, I would appreciate any and all suggestions you have and tips for me, because I don't have any help. My brother refuses to help, even though he's retired. He could come. I haven't had a night away in over 5 years. I have not had a night away in 5 years. Thus explaining why my stress level is high. Thus explaining why I have a bit of high blood pressure now. I'm not allowed to take my blood pressure for 3 months because I got too weird about it. I got way too upset taking my blood pressure. We know it's good. I know it's good. I just got upset. I felt like I was failing. You know, I mean, I reacted to a diagnosis of high blood pressure like I reacted to a uterine cancer diagnosis. I freaked out. This was 2 months ago. It's like, what the hell is this? And I just was taking my blood pressure every day, sometimes twice or 3 times a day. And I honestly, I know bladder stuff. I know bowel stuff. I've never studied blood pressure before. Never. And so I was not really understanding how your blood pressure ebbs and flows throughout the day. Like, it gets high in the morning. I mean, it increases in the morning as you wake up in the morning, and then you've got highs and lows and highs and lows and highs and lows throughout the day, depending upon what's happening. Your blood pressure is supposed to go up during periods of stress because it helps you fight or flee, right? And so I was taking it every day, and I did not understand how menopause changes blood pressure. I did not understand that. I literally passed over the cardiovascular chapter in the Menopause Manifesto. I was like, oh, that'll never happen to me, right? My dad's going to be 100. Never going to happen to me. And I did not understand that the loss of estrogen causes your blood vessels to get stiffer. And because they are stiffer, it takes more pressure to pump the blood along, which is why 30 to 50% of postmenopausal women have high blood pressure. And then the other thing I really didn't understand is that with menopause, you lose your ability to process salt well. So we become far more salt intolerant. And I was eating a ton of salt every day. That was my snack every day. I had salty popcorn. I had salty Lay's. Literally at 1 a.m, the night before that appointment, I ate a small bag of Lay's potato chips because I'm a stress eater. My daily life is stressful, and it was coming out with me eating after dinner. And I had gained 20 pounds for COVID. And so it was 150 over 100. I took it every day for 2 weeks. It was 150 over 100. That's freaking high. So I stopped all the salt. I started exercising every single day. I have lost probably 13 pounds now out of the 20 that I gained. I think I only have 5 or 6 left to go. And I got my blood pressure from 150 over 100 back down to the 120s over the 80s. But every now and then it would go up. Like once out of every 6 or 7 days, it would go up to 146 over 96 or something like that. But then it'd go right back down. Every time it went up, I just freaked out. I just freaked out. So finally, I ended up at the ER with chest pain, and they did all the tests, and they went, Jill, your heart's fine. I did a stress test. Jill, your heart's fine. I showed the cardiologist and the ER docs my blood pressure diary, and they go, Jill, you're fine. For God's sake, you look great. You've done fantastic work. And my answer was, then why am I so upset about my blood pressure? Why do I have a panic attack just looking at my freaking blood pressure cuff? Like my heart rate goes way up. And I finally I had a consult with my doctor like last Monday, and I was crying with her on the phone, or maybe 2 Mondays. I was just like, I don't understand why I'm so upset about this. I'm so upset about this. And I said, all I have to do is look at the blood pressure cuff, and I get really upset. Like I have failed. I feel like a total failure. And she was great. She was so good. Just woman to woman. She was like, Jill, number one, you have mild hypertension, and you barely have that. We have patients, we only test their blood pressure once a year. You are in that group. You are doing everything right. You have done everything right. You are better. Stop worrying about it. But I couldn't stop worrying about it. I just couldn't. And so finally she just said, put the blood pressure cuff away. You're done. You're done. No more taking your blood pressure. Don't. And I went to the dentist. They wanted to take my blood pressure. She said, don't do it. Stop. You're obsessing about it. And I'm like, yes, I was obsessing about it. Mary says, salt is in everything. It causes water retention and affects your blood pressure. Exactly. Now I look at everything, and so Mary, like I got Chinese food. I asked them for no salt, and it was salty. Oh my God, ranch dressing. ranch dressing. Like I love ranch dressing with carrots, you know, on avocado, whatever. Ranch dressing, I hadn't had it for a month. I tried it again. It is so salty. Like I spit it out. And I made Chinese food. I'm just making homemade everything, and I'm trying to keep the salt as low. I might just do a tiny, like I made yesterday. I made something called Pretty Pretty. It's our family. Yeah, Mary says, "Oh my God, soy and Chinese food." But I know, but I'm trying to keep my elderly parents eating. It's hard. So our favorite Swedish breakfast is called Pretty Pretty. We have had it from day one, and what it is it's a homemade cream sauce that you put on top of toast, and then you put scrambled, yeah, hard boiled egg yolk on top. You grate it, and it's a little powdery. Anyway, it's the total family thing, and I didn't use any salt, and I could tell. So sometimes I put just a little tiny dash of it in there, like if I'm making a white sauce or something. Renee says, perfect. You're singing my song. I'm having to get this walking going. You're worried about your parents. It's okay. Health grief. I have grieved my health. Yeah. It's just exhaustion. You know, I mean, it's just like, come on. You work so hard. You get the bowels calmed down. You get the bladder calmed down. You know, and then COVID hits, right? And the stress. I was reading something about how COVID has changed us, and it's added so much stress to our lives. And this new variant of COVID in Europe is really bad, worse than anything. And so, you know, our stress level is just, whew, man, off the charts. And I have to be honest and admit that I'm affected by it. I'm affected. I am definitely affected, but I think we are all affected by it. And there's no shame in that anymore. I refuse to carry any shame. I'm going to say, hey, I need help. I need help with it too. I do. The other thing that I've been doing, you know, is I'm really trying to understand IC subtype 5 chronic overlapping pain conditions. And for those of you who don't know, we have this fabulous research alliance, Chronic Pain Research Alliance, that for the last 15 years has been trying to get to the bottom of why do some patients get multiple pain conditions. And it goes right back to what we call a central nervous system maladaptation, or a central nervous system injury, for lack of a better term. And how does the central nervous system get injured? How does the brain get injured? And for those of you who have Apple Plus TV, you have to watch Oprah and Prince Harry's documentary. It's like a 6-episode documentary that talks about how the brain responds to trauma. And listen, Oprah is amazing. I was not an Oprah fan. She is stunning in her understanding of the human body and her early history of trauma and how the brain changes with trauma. And I've shared that I had a lot of trauma when I was younger because I grew up in a neighborhood with a rapist murderer, and I was one of his early victims, right? And so I had a lot of early trauma. And so I've been reading a couple of different books on that, and it just kind of makes my head spin. I understand. I understand now what happened. As Prince Harry says in the documentary, and as Oprah says, it's not what's wrong with you, it's what happened to you that matters. It's what happened to you. And then Prince Harry, in the last episode, it's very clear and says, it's not, mental health is an unfair word. It's mental injury. It's injury for many who have been traumatized. So anyway, my head has been spinning with that, to be quite honest. I'm reading a couple of books, and it's just very hard for me to absorb because I go right back to what happened to me. It's quite interesting. Yeah, the grief is real. The grief is real. But see, listen, we can't change what happened. I will never be able to change what happened. I can't. It's over, it's done. And I spent years, decades letting that rob me of being attentive to this moment. And I think a very important thing that we have to really embrace is it's over, it's done. We can't change it. There's no reason to think about it anymore. And we don't want that to dominate our future. What we have at this moment is this moment. What can I do right now to put my brain, my heart, and my soul in a better place? It's not helpful to live in the past, but we have trauma that we have to deal with that we might need some, coaching with and some therapy with. But at this moment, ask yourself, what can I do to put my bladder in a better place? What can I do to put my pelvic pain in a better place? Is it getting out, taking a walk to clear your head? Is it getting your wand out, doing some physical therapy? Is it doing some stretching? Is it making a great IC-friendly meal? Preston said, can 150 milligrams of vitamin C cause a flare? Hell yeah, definitely. Look at the bottle. If it's vitamin C, ascorbic acid, ascorbic acid and citric acid are the two most irritating acids. If you're going to do vitamin C, you need to do an ester C. An ester C is a different chemical form of vitamin C called calcium ascorbate. And we have it in our shop, ester C. I don't know if it's in stock right now, but look for an ester C. Also, Google veggies that are high in vitamin C. Broccoli is high in vitamin C. Green peppers are high in vitamin C. Both of those are bladder friendly. The vegetable aisle is your friend, my friend. The only vegetable, and it's not even a vegetable, it's a fruit, the only things that we got to be careful of are tomatoes and citrus. The great majority of other vegetables are fine. You should be able to eat. You should be able to eat broccoli. You should be able to eat butternut squash. You should be able to eat potatoes. You should be able to eat celery. You should be able to eat carrots. It is a rare patient who cannot do that. There are a few patients whose bladders are so compromised that eating is challenging. Those are the patients with really severe Hunner's lesions disease. But for the rest of us, the vegetable aisle is your friend. What's not your friend are all the processed foods in the middle of the store. You got to stick on the borders. You got to go over to the bread section and the meat section and the fruit section. Renee says, got my new travel pillow, ordered it from the IC store. It's great. Oh, I'm so glad, Renee. I'm so glad. It's a good cushion. It should last you a long time. It should last you a long time, good couple years, hopefully. Just know the more you sit on it, it's slowly going to flatten over time. But this is a much better quality cushion than the ones that we had. The other thing, I guess the other thing that I'm really thinking about, my doctor really wanted me to think about it, is to cut back on animal proteins. Like I'm not eating bacon now or sausage now because of the salt. I'm eating cheese, cheddar cheese. Most of the cheeses are IC friendly. They all got reclassified from caution. And so she wanted me to really cut way back on the animal proteins. And that's so weird because like my dad's been eating meat and potatoes his entire life and he's going to be 100. But he's not a menopausal woman, So coming up with so I made stir-fried vegetables with tofu last night, and it actually was terrible. It was terrible. It was so bad. The time before that was good. this time was terrible. And I, it's like, all right, guys, try it out. If you don't like it, I'll make you grilled cheese sandwiches. Deborah says, I get that. I had trauma in my life. It is hard not to think of the past. Sometimes I'll have nightmares, even when I'm totally not thinking of it. It's like your brain just wants to remind you. That's the thing about the brain. And that's one of the things that I've been reading about in these brain books is that a lot of this is stored in your brainstem. In your brainstem, there's no cognition happening in your brainstem. Your brainstem remembers the trauma. Thus, 30, 40 years later, if you walk into a room that has a smell you associated with that trauma, your brain goes right back into fight or flight from that. That's how your brain protects you. And I'm reading this one of the books I'm reading is also an Oprah book with a brain scientist, and they were talking about how does a baby get comfort? What is that baby's safe zone? You have an infant. And that safe zone is in good sensory information. That baby associates the smell of the parents, smell of the mom, the smell of the dad with happiness. The touching, the sounds, all that sensory information is playing a critical role in how that baby's brain is developing. And if that baby is not having its needs met, if that baby is not getting that comfort, that smell, that baby's brain goes into fight or flight. And that creates a foundation for fight or flight their entire life. And how we have to bring that brain out of fight or flight. And I had a great childhood and home. We just couldn't change the fact that whenever I walked out of my house, I was afraid. And that wasn't just for 1 year, it was for over 10 years, from 4th grade through high school. So you're right. You're right, Deborah. That's just the way the brain is built. If there's sensory stimulation that your brain associates with trauma and you encounter that again, your brain is going to go right back into that trauma. I had this really mean, cruel boss in college. I worked for the UC Santa Barbara Alumni Vacation Center. I was a tennis teacher, and my boss was just, he loved humiliating me publicly. And he didn't just do it once. He did a lot. And it's like, I remember the reason why I finally left is we had our end of the year party, and he called up the other 2 tennis pros to the front and gave them beautiful jackets. And he excluded me. And the entire room went, oh. It was such a public humiliation. I just ran out of the room bawling. I was 19 or 20. I was bawling. And I ran to my room and I just started packing it up. And finally, somebody came and found me, and I was just sobbing. And I said to her, why does he hate me? What did I do? And she said, Jill, he just doesn't like you. And I'm like, then why the F did he hire me? You know why he hired me? I know exactly why he hired me. It's because my cousin was a competitor of his, coaching another tennis team. And he thought he could bring my cousin down by bringing me down. And so, there are moments like that that are imprinted that, I mean, obviously you can tell it still upsets me today, and it's 40 years ago. Which is right. I try not to think about it. But, you know, we got to be real. But I refuse to let him rob me anymore. He's not going to rob me of my dignity. Screw him. Screw him. I know that at the end of the day, when I meet my maker, I will be very proud of what I've done in this life. And I never have treated anybody disrespectfully like that. And so he will have a reckoning. It might not be with me, but I am confident that he will have a reckoning. Fida says, how do you think hyaluronic acid helps? So I see hyaluronic acid, also known as sodium hyaluronate. Those are building blocks of the bladder wall. If you were, thank you, Renee. Renee goes, amen, sister. If you have TMJ, for example, or you got bone-on-bone arthritis, one of the things that they will often do is they will give you an injection of hyaluronic, which is found in your joints. I mean, it's not in bony tissue; it's in connective tissue, and it's just kind of, it's not quite a lubricant, but it is kind of a lubricant. And so they're injecting hyaluronic into the joint to give it some lubrication so that it's not bone on bone. So hyaluronate is found throughout the human body. Hyaluronate is actually found in the bladder wall. And so hyaluronate as a bladder installation is known as cystostat, or there's a new name for it, which I'll have to go back and find. Or you can do a supplement that contains chondroitin and hyaluronate, and that's going to be Bladder Builder, Cystomend. So the best supplement that has a really thick, robust coating effect for the bladder is Cystomend by far, because it's got like 3 times the amount of the essential ingredients in there. So if you're trying to transition off of Elmeron, if you've got severe estrogen atrophy and you're waiting for the topical estrogen to kick in and to try to help your skin, Cystomend is the best bladder coating. It's the strongest bladder coating. And a lot of patients are using it now. I had somebody on Amazon. So somebody on Amazon bought Bladder Rest, and they gave them a stomach ache. And they were quite upset about it. And they sent an email and they asked for a refund, and we gave them a refund. Absolutely not a problem. But what I explained is I said, listen, there isn't a supplement used by ICers that's not associated with side effects, except for Preleaf. You know, Preleaf is probably the best tolerated, or all of them. But if you're prone to kidney stones, then you're probably not going to be able to take Preleaf because it's got calcium in it, right? But whether it's aloe or whether it's chondroitin or any of the other supplements, some patients do respond, and it can give them stomach aches. Back before we had these other supplements, all we had was Cysto Protect. And so I decided to try Cysto Protect. And what do we normally say? Take 1 capsule, wait 24 hours, see how you do. 1 a day for a week, see how you do. If you're okay, you can go up to 2 a day. If you're okay, you can go up to 3 a day. If you're okay with that, you can go up to 4 a day. But never, ever take the full dose on the first day, especially if you're sensitive. You have multiple pain conditions. And that's what I did with our Bladder Smart multivitamin, our old Multi-Right multivitamin, the low acid vitamins. Now it's Bladder Smart. I did 1. That's good. I did 1 a day, actually, for a couple months. So it's fine. Went up to 2 a day. It's fine. Now I can do 3 a day. No problem at all. The Bladder Smart low acid vitamin is an exceptionally good multivitamin for patients who are sensitive. But with Cysto Protect, I took 1 and I was okay. But when I went to 2, it made my stomach flip and it gave me loose bowel. And if I tried 3, it was like diarrhea. And so I just did 1 a day. And I was okay with 1 a day, but it was like for about 20 minutes after swallowing it, my stomach was like going, I don't know if I like this. I don't know if I like it. And then it was fine. So understand that we are all different. And sometimes there are some patients who have very strong systems. They can do 4. Others, like me, more sensitive, I can only do one, maybe even a half of one. And I remember one of the doctors, I think it was Robert Maldwin, in his book, The IC Survival Guide, was talking about Elavil. And he was talking specifically about patients who are super, super sensitive to Elavil. You couldn't take 10, you couldn't take 5, you couldn't take 2.5. He said, crush it and just take a couple of grains and slowly work your way up. And sometimes that's what we have to do with meds. It's interesting. You know, we always want to try to, don't get stuck in chasing the symptoms. That's where you get in trouble with meds, because you start adding more and more and more and more. It doesn't matter. They could, it could be Elavil, and then it could be hydroxyzine, and then it could be Miratrix, and then it could be this, and then it could be neuromodulation, and then it could be, and before you know it, you're doing 7, 8, 9 things. And our AUA guidelines are saying, stop what you're doing, take a step back, revisit the diagnosis, because for some of you, bladder therapies will never work because it's not bladder driven for you. It's pelvic floor driven, it's muscle driven, or it might be central nervous system driven. Rhonda says, hi, Jill. Us ICers have been through so much watching our eating. I go through the same thing, checking all the labels. It's exhausting. I have to make all my food. I seldom eat frozen foods except vegetables. The sodium is in. Here, hold on. It's in ice cream, dairy free. It's the worst with sugar. Okay. It's the worst with sugar and sodium. Getting older, I find myself eating less. My blood pressure was going up and down. I was taking my blood pressure obsessively because my only sibling died of a heart attack. He was in the hospital. No, honey. Frozen foods are loaded with sodium. I don't eat red meat. Eat for chicken. Sometimes I make my own tortillas, gluten-free. It was so exhausting when I started the IC diet years ago, let alone going through the sodium part. My downfall with snacks. Thank you. Thank you. I make popcorn sometimes without the sodium, sometimes sweet potato fries. I have to make everything. I love cauliflower steaks baked in the oven. That's it. I'm impressed that you can eat cauliflower. You couldn't pay me to eat cauliflower. It's just too gassy for me. I know when my bladder is high, I will feel like I'm so out of it, like the days are fogged. I sweat. I also know exactly how you feel. You're not alone. I couldn't really tell. The only way I could tell that my blood pressure was high, it was like my head was swimming. I didn't really get it was just like, it was like there was a sparkler inside my head, The most important thing my doctor said to me is, she said, number one, doing the stress test was huge because my heart's fine. I have no heart disease at all. She said, Jill, you're mild. Why do you think you're severe? You're mild. And you're barely mild. And yet I was having that reaction, right? Just like we do. It's been the first time I've gone into a really severe anxiety in 20 years. And so I've had to go right back to all of my core anxiety management skills. And I'm coming out of it. I'm like 85 to 90% better now. I am. But it's amazing how that brain reacts, with fight or flight. It's amazing. It's been a good lesson for me. I always think that when something happens to me, I'm supposed to learn from it so that I can share it. Vita says, how much do bladder installations help? Do they make things worse at the beginning? They say it should be repeated. Hi, Donna. They make things worse at the beginning. They say it should be repeated for 6 sessions. Is it true? Vita, it depends upon what the installation is. So, we don't do silver nitrate or chlorpactin installations anymore. We don't do bladder strippers anymore. That was back in the old days when they thought that there was something fundamentally wrong with the bladder wall. So the theory was if you strip the bladder wall off, a new healthy bladder wall will grow. Okay, we don't do that anymore. There's no reason to strip a wound and make it bigger. So we really basically have three categories of installations. We've got DMSO, also known as RIMSO. And DMSO is, they originally thought was going to be kind of a wonder drug. DMSO was discovered in the 1950s when they were trying to come up with a way to transport kidneys from one hospital to another for kidney transplant. And they could see that if you freeze a kidney, you destroy the kidney because the ice crystals destroy the kidney. So they were looking for a solvent that they could use to carry a kidney from one place to another. And they found DMSO, which is a byproduct of paper manufacturing. And they got very, very excited. And back in the 1960s, they thought DMSO was going to be an absolute wonder drug for all sorts of different diseases. Well, it isn't. It failed every single research study. It barely passed the IC study. It barely made it as FDA approval for IC. And unfortunately it did. And I interviewed the guy who invented it and actually wrote the insert, the product insert that came with DMSO. And they were crazy back then because then he also invented MSM. And then they were injecting DMSO and MSM into the bloodstream, which is just crazy stuff. And so DMSO has, they don't really understand what it does. It's a good penetrant. It causes mast cells to release histamine, so it exhausts the mast cells. It gets deep into the bladder wall. Who knows what it's doing deep in the bladder wall? We had some research studies 20 years ago which showed that DMSO at full concentration actually caused irreversible bladder spasms, like your bladder went and it never went back after DMSO installation. And so the consensus at that meeting was DMSO should never be used at a 50% dose. It should only be used at a 25% dose with other meds to prevent that from happening. So it's really fallen out of favor. I don't really know a lot of doctors who are using it anymore. You don't hear it discussed that much anymore. Instead, doctors have turned instead to rescue installations. And rescue installation is usually heparin and lidocaine. The reason why it's a rescue is because it rescues you out of a flare. Normally, after you have a rescue, you walk out of the doctor's office pain-free for 5, 6, 7 hours. And everybody wants that. If you're in a flare, you want to be able to go to the doctor and have somebody turn pain off. And so rescue installations very quickly became the top instill. The challenge with rescues is, number one, there are ingredient shortages often. And some people are sensitive to lidocaine. And so if you've ever had a rescue and it hurt, that means you're intolerant to something in it. And then doctors play with the formula. So there are a lot of different formulas for rescue. Rescues, again, heparin, lidocaine or marcaine. Some doctors will put a steroid in it. Some doctors will put an antibiotic in it that usually has a little bit of sodium bicarb in it to help it absorb. And so you can find all those published formulas for rescue installations over on the IC Network website, icnetwork.org. I list all of them with the research studies. Some doctors just do heparin or hyaluronate separately. And then some doctors have just done the anesthetic installation separately, just lidocaine, just to turn the pain off. They're not constructive therapies. They're therapies designed to turn symptoms off. They're not necessarily fixing the underlying problem. And again, that's where you have to have laser focus, is cause versus effect. When you're working with your doctor and you're going in and talking about your symptoms, you shouldn't be asking first about symptom management. You should be asking about what could cause these symptoms. So again, as an example, if you feel like you're carrying a bowling ball around in your pelvis, that's not your bladder. That's not your bladder. If you have pain by your left hip bone, that's not your bladder. If you have pain by your rectum, that's not your bladder. If you have pain that shoots down your leg, that's not your bladder. And so you have to really ask the doctor, okay, what can cause this pain that's shooting down my leg? Hey, it only happens once a month. Or one of my favorite ones, which I think is just so interesting, is something called proctalgia fugax. It hits you with no warning. You get a violent rectal spasm. Like, oh my God, what is this? And you can't move. You're like, oh my God. And you're stuck in this position. You can't move for like up to 20 minutes. Proctalgia fugax. And what's crazy about proctalgia fugax, now all the research that's done, they never find a cause. There's no underlying pathology. Like you're convinced you're being freaking stabbed up the rectum. And it was Dr. Jerome Weiss who finally explained it. Proctalgia fugax is just a violent spasm of muscle and sphincter right by your rectum. It's crazy. What was this picture? Hold on a second. I love showing you guys pictures. Hold on. What was that? This is such an incredible book. I just turned it. I mean, every page has a learning lesson in it. In my strong opinion, based on 45 years as a practicing urologist, chronic perineal pain in men is seldom the result of a prostate infection. In fact, I have yet to see a case. Again, in men, we really want to look for, here it is right here. Proctalgia fugax, the ultimate anorectal pain. And I had this in my 20s. And it's like, and I remember going to the doctor. Oh, you just need to eat fiber. Yeah, okay, believe me, I was eating fiber. Nobody ever looked at my pelvic floor. Proctalgia fugax occurs suddenly with only a brief premonition that one might be coming on. And during an attack, one may be completely incapacitated and unable to move. To make a diagnosis of proctalgia fugax, 3 symptoms must be present. Recurrent episodes of pain localized to the rectum, the lower rectum, episodes that last from seconds to minutes, and an absence of anorectal pain between episodes. An estimated 14% of the population has this disorder, though the incidence may be much higher in those with GI problems. And for me, it was when my IBS was bad. Furthermore, because the attacks are sporadic and quickly and completely resolve, many who experience them may not seek medical care. This leads me to suspect that 14% may be an underestimation. Proctalgia fugax attacks come on suddenly with, hold on. While generally the severe spasms can last from seconds to minutes or so, some patients have reported episodes of 10 minutes or longer. The attacks are sporadic, recurring at unpredictable intervals from weeks to months and at any time of the day or night. Patients have compared the intensity to that of natural childbirth, kidney stones, or gallbladder attacks. And it feels like cramping, gnawing, sickening to a sharp object piercing the rectum, like the sensation of being squeezed in a vise, to name but a few. I also received a vivid, unrepeatable description from a patient who sells real estate. One afternoon, he placed an emergency call to me from his car, which had somehow managed to pull off the road and park. He was planning to be, quote, right on time for an important meeting with a prospective client when he had an encounter with proctalgia fugax, and he was in a state of panic. Dr. Weiss, tell me something I could do to make this blank pain go away, he desperately implored. Unfortunately, I could only reassure him that it would go away without intervention in a matter of minutes, as it always had, and waited patiently on the other end of the line until that happened. It was first described in 1883. Based on my clinical findings over the year, I feel comfortable declaring pudendal neuralgia and or spasm trigger points of the pelvic floor to be the clear cause of proctalgia fugax. Tight muscles. We are pelvic pain patients. Afida says, what about laser treatment? They say it will stop bladder bleeding. Well, if you have Hunner's lesions, yeah, laser therapy is reasonable. But if you don't have Hunner's lesions, laser therapy is pointless. Remember, too, some of you have had hydrodistensions, and they didn't tell you you had Hunner's lesions, but they did tell you that you had glomurulations, little red dots on your bladder or little broken blood vessels on your bladder. And for 30 years, we all thought that was IC. We thought that those little broken blood vessels that seen during the hydrodistension was a sign that this was a bladder disease. However, that is now completely thrown out. Why? Because it's a byproduct of the test. When you stretch the bladder, you break blood vessels. And it's seen in anybody who has a hydrodistension and lots of other conditions. It's not specific to IC at all. So if somebody told you you have a bladder disease because you have pinpoint hemorrhaging on your bladder wall, petechial hemorrhaging glomurulations, look at the new AUA guidelines. They're thrown out. They're not meaningful at all. Byproduct of the test. So there's no reason to laser your bladder if you have petechial hemorrhaging. We want to laser or cauterize a wound in your bladder that's bleeding profusely, like a Hunner's lesion. Jeannie says, I'm finally getting an MRI to see what is pinching on my nerve. Good. I had 300 lesions full graded, but you're still having blood clots. Also tremendous nerve pain. Doctors suspect pudendal neuralgia. I also have vulvodynia, so I'm hoping the MRI will help doctors help me. I'm up 15 times a night at least. It is the pain that wakes me up. I just thought I would let you know I'm a mess, but I'm not giving up. And Jeannie, that is so incredible. I'm so proud of you. I am so proud of you for asking more questions. That MRI is going to be huge. I also want to know what the health of your pelvic floor is. You know, so you're doing a proper diagnostic workup, and that's great. But the vulvodynia, the IC, you're right. We're looking at nerves and we're looking at muscles, and if you have a nerve compromise, the MRI might show it. What my MRI showed was that I have compressed discs at L4 and L5. So I didn't have this before. This was new. So we had a fire. We had to evacuate 2 years ago. Our house almost burned down here in California with a fire. And the fire at 3 houses away by the time we were driving. And my dad refused to leave without his gun case. And I had to drag a 70-pound gun case up a flight of stairs. He was irrational. And I couldn't get him to leave. And the fire was here. And so I dragged it on adrenaline. I dragged it and I ruptured discs in my back because of it. And so I have to wear a knee brace. If I don't wear a knee brace, I have pain in my right thigh because I have a femoral nerve injury. So I think the MRI is great. You know, listen, with the MRI, so, you know, the MRI is where you're in a tube and it's loud. It's going to go beep, beep. It's going to be really loud, a loud pulsing sound when it starts working. And you'll be in there for 20, 25 minutes, depending upon what they're doing. There are small tubes where literally as you're in and you look up, the top of the tube is like 3 inches from your nose. And some people, they can't do it. What's the name of that condition when you're in a small confined place? They panic. So a little bit of Valium. It's the first time in my life I've ever taken oral Valium. They gave it to my for my hysterectomy. I didn't use it, but I saved it. I took it before my MRI. And the other, so you can also ask to see if they have the bigger MRI, because not everybody will fit in the small MRI. There are some MRIs that are much bigger that are designed for people that are larger and heavier. So, question number one is, do they have a bigger one? If they have a bigger one, you're gold. If you only have the smaller one, little bit of claustrophobic. Thank you, Donna. Thank you. That little bit of Valium, tremendously helpful for me. And I just did my meditation. So I did I Spy, my favorite, I Spy, and then I did a chakra meditation. So for the first 10 minutes, I did that. And then for the last 10 minutes, I counted by sevens, and I got up to like 700 and something. And it was interesting because as long as I was counting, I didn't get scared. If I stopped counting, I felt the anxiety. You got to keep, so we have to, and that's part of brain science here, is when you keep the brain busy with other things, it cannot get sucked into anxiety. And so it would be great if they could play some music. It would be great if you could listen to a book on tape. You could ask them if they can play some music. Some do, some don't. But it was the first time in my life where I absolutely saw that as long as I was counting, I was good. But if I stopped counting, I started to feel a little bit more anxious. So I just counted. I just counted. And girl, it worked. If I got through it, you're going to get through it just fine. Just count by 7, 14, etc. 21, 28, 35. Magali says, I have IC and a cystoscopy. They found hundreds. Hey, welcome, Chile. I don't get to work with a lot of patients in Chile. Thank you for dropping in. So what did they do for your Hunners, hon? Did they treat them when they found them? Jeannie says she was dismissed from physical therapy. I was told it wasn't that. But I'm going to look into physical therapy a little bit more. Well, I mean, it'll be, once you get the MR results, it's going to be interesting. So like when I ruptured the disc in my back, my right leg got very weak and would give out. My knee would give out. And that's how I knew I was in trouble. That was an ambulance ride to the hospital, as a matter of fact, on a Friday night, the first year of COVID. Because I could not walk. I had no feeling in my leg at all. And it was my right leg, and I couldn't drive myself. And by that time, I was on pain meds. Didn't help. So Magali, how did they treat your Hunners when they found them? Did they treat them at all? Donna, how are you today, girl? How is life treating you? We're just hanging out. Listen, it's a cold fall day here. Foggy. It's I love it. I love it. We are done with 115 degrees fire weather. Yes. Jeannie says, I'm getting the bigger one as far as I know, and also the Valiant for sure. Yeah, definitely. Oh, Rhonda said they put earphones on you with music. That, I asked, they didn't have anything for me. I'm part of Kaiser Permanente, and Kaiser is not doing well right now. Kaiser is all the healthcare right now. It doesn't matter where you are. So many doctors and nurses have left medicine. A lot died in COVID, and a lot are still dying with COVID, and a lot burned out and they've left. And so everybody's terribly understaffed. Terribly, whether it's your dentist or whether it's your urologist, the staffing is very, very difficult. And so Kaiser is kind of they're focusing on symptom management rather than the treatment of underlying causes because they just don't have the time. Like I wanted to get trigger points on my neck. I mean, I wanted to get trigger point injections on my neck. This all goes back to that rear ender and why my neck gets so tight. And I have a trigger point here that is, it's small today. That's good. Sometimes it's like this big. It's like my whole neck gets locked down and there's a rock there. And they didn't have anybody do trigger points injections. Like, you don't do trigger point injections? What do you do? What do you do when somebody has a trigger point? Oh, we send them outside of clinic. They have to pay for it out of pocket. And it's like, but this is so fundamental to care. It's baffling. And you're lucky to get into physical therapy weekly. I mean, you cannot be seen weekly with physical therapy at Kaiser. I think that they have taken the money that they should have been reinvesting in hiring more staff and improving facilities, and they're just it's gone into profits. Kaiser has two different arms. They have a for-profit arm and they have a nonprofit arm. The hospital is the nonprofit arm. The medical services are the for-profit arm. And so I think that they have funneled, and the medical group has to negotiate with the nonprofit for their money. It's all convoluted, and it's not serving the patients well. I truly believe that Kaiser is on the downslide right now, and it breaks my heart because I've been with them for 30 years. Donna says, I'm doing good, still having the same issues, vulvodynia, still having pain when you have a bowel movement. I would be making an appointment with a pain management doctor. Donna, did you ever have, yeah, the crosstalk is real. Just out of curiosity, did you ever have an MRI? Did they ever look at your spine? For any nerve issues at your spine? I mean, because it's been so persistent for you. I mean, you're not seeing ebbs and flows. You're just seeing very, very persistent pain, correct? I think it'd be interesting. I mean, especially the pain when having a bowel movement. Like, what is that? What is that? Is that, you know, when you think about the nerves, so the nerves come off of the spine at the sacrum, then they come through the sacrum, they go through muscle. They kind of, you know, they go through muscle like this, right? And then they merge, and then they break apart, and some of the nerves go down the legs, et cetera, et cetera. But there are nerves that are proximal to your bowel. I have shared that in my 20s, I started getting this crazy tingling in my feet. It happened, I first noticed it when I was laying on my couch reading, and my bottom of my feet were tingling. And it was weird. Like, what is this? Because I already had the IBS and all that other stuff. I was like, what the hell is this? And I finally was able to correlate that with bowel movements, because about 10 minutes later, I needed to have a bowel movement. And once I had the bowel movement, it was fine. Bowel movement and then vulvar pain. Very proximal. It's very, very proximal. Let me just see if, I don't know if you have this book or not. Do you have? Did he talk anywhere in this book about two pathways to pathology? Okay, hold on a second. Pathway number 1, the pudendal nerve is injured, perhaps during childbirth or from biking on a hard, narrow seat. To give but two of many possible examples, it then sends signals to the muscles it innervates, causing them to tighten in response and develop trigger points, a muscle fiber injury. The trigger points maintain pelvic floor tension or spasm, which can compress the rectum, the urethra, the vagina, and intensify the nerve injury. Both the nerve injury and the muscle spasm can produce a variety of symptoms, including urgency, frequency, urgency, vulvar, vaginal, anal, genital, perineal, orgasmic, tailbone pain. Typically, a vicious cycle develops whereby the muscles and nerves continue to aggravate one another until they are effectively treated. In this scenario, the pudendal nerve is a primary source of symptoms. That's on page 351. Pathway number 2, the pelvic muscles develop trigger points unrelated to nerve injury from habitual straining or tightening with physical activity or constipation, repetitive or acute trauma, biomechanical abnormalities, inflammation associated with pelvic organs, or stress. As in the above scenario, the trigger points maintain pelvic floor tension, which can sensitize the pudendal nerve and compress the anus, urethra, and vagina, creating the symptoms previously enumerated. The engagement of the nerve heightens the muscle tension and can multiply the symptoms. Furthermore, if the hip rotator muscles become involved, they can directly compress or entrap the nerve. While neither the piriformis nor obturator internus is innervated by the pudendal nerve, they both come into immediate contact with this nerve inside the pelvis. As in pathway 1, the muscles and nerves cyclically aggravate one another until both components are effectively treated. In this scenario, muscles are the primary source of the symptoms while the nerve is secondary. Obviously, there are many complexities to sort through here. The challenge for practitioners lies in determining the primary source of chronic pelvic floor or perineal muscle tension. Is it the muscle or the nerve? An examination of the nerve should give us the answer. Okay, so Donna, okay, so go to page 352, second paragraph. An examination of the nerve should give us the answer. If it is exquisitely tender when palpated and remains tender after the surrounding muscles have been relaxed with internal release and the nerve has been mobilized, nerve sensitivity or damage is most likely causing the muscles to tighten. On the other hand, if the nerve sensitivity decreases or disappears after internal myofascial work, then the muscles are the issue. I betcha, girl. I betcha. You know, we always talk about this. We always talk about the chicken or the egg, which comes first, the chicken or the egg. And for us, it's which comes the bladder or the pelvic floor. But we need the chicken and the 2 eggs. Yeah, Donna says she thinks it's the nerves. Yeah, I think it is too. I think it is too. And you know, I remember my first year with bladder pain, I had a very clear progression, and that was I would start with vulvar pain. So I'd have vulvar pain for a day, and then the next day it would become urethral pain, and then the day after that it became bladder pain. So it was vulva, urethra, bladder for me consistently over time. And I remember I talked to my urologist about it, and I said, why does this happen? Why in this sequence? And he's like, I don't know. We've never seen a connection. But now we know the connection. And now we know for me that it was never my bladder. It was always my muscles and nerves. And so with hindsight, what have we learned? That when that happened, my pelvic floor muscles got tight. And they were squeezing a nerve. They were squeezing the nerves. And the first area that spoke with discomfort was the vagina and the vulva, or the perineum, which he talks about. Then, as the spasm compressed and got more nerves involved, the urethra became involved. And then, eventually, the bladder became involved. And I think about all those flares where I thought it was UTI, all those flares where you self-medicated with antibiotic. And the thing that proved it to me, the thing that absolutely proved to me that my bladder flares were muscle flares, I'll tell you exactly what happened, because I was feeling a bit better. And so I was trying to play tennis again because I was a professional tennis player when I was a kid. And so I was just going down to the neighborhood courts and I was just playing. And I picked up a match, a doubles match, and there was a prick of a guy on the other side who went, "Wow, you're a good tennis player." And I go, yeah, it's pretty good. I was ranked. And so he decided to try to outplay me. And he hit the ball as hard as he could at my face. And I jumped back suddenly and I got my racket up and it didn't hit me in the face. But I thought I had become incontinent. I was absolutely convinced. I felt liquid coming out of my urethra. And I thought, oh my God, there has to be a puddle underneath me. I looked down, there was not a puddle. But for the rest of the match, I locked my pelvic floor down. I was like, okay, I'm going to finish this. I'm going to beat this son of a gun, which I did, right? And I had locked my muscles down so hard that I had a flare that night. And it was a bad flare. And it was a peeing all night, frequency, urgency, pressure, etc. But I knew exactly what triggered it. It was the fact that I tightened my muscles down. And I directly saw and accepted and experienced the fact that my muscles could cause all of those bladder symptoms. And what worked to break me out of that flare was a muscle relaxant. Bladder treatments would not have done anything for it. Ashley said, I had a severe flare for over 2 months now. They did a hydrodistension. After coming home, my legs have been going, oh, whoa, whoa, oh. Whoa, whoa, whoa. Ashley, girl, are you kidding? She said, I had a severe flare. They did a hydro. After coming home, my legs have been going numb and my hands have been going numb. My doctors say it isn't caused from the hydro, but I think it was. Well, a hydrodistension would not cause your hands to go numb because the nerves that affect the bladder are L4, L5. They don't have anything to do with your hands. But your constipation is worse, and they're doing an MRI tune to see if I'm having trouble passing bowel movements. It's been a rough road. They want to do installations. Well, okay. Ashley, we have to figure out what kind of flare you're having. There are different types of flares, hon. There can be a bladder wall flare, there can be a pelvic floor flare, and there can be a stress flare. And there can be a hormone flare. So let's see if we can figure it out. I wish you were at the meeting I did a drop-in meeting on Friday night here, and we went through our entire flare management protocol. So let's try to do a little bit of that again. So Ashley, when is your pain the worst? Before you pee or after you're done peeing? When is your pain and discomfort the worst? Is it the worst as your bladder is filling with urine? And do you feel better once you pee? Or do you feel better after you're done peeing? Ooh. Okay. How old are you, hon? And you don't need to give me the exact age. Just, give me a decade. Late 20s, mid 30s, early 50s. What's your age? And when they looked inside of your bladder in the hydrodistension, okay, so you're 36. Okay, so hold on. So Ashley's 36, but you do have some pain afterwards, only for a small moment, but that's really, really important. And you've had IC since you were 21. Okay. So remember, IC is a grab bag diagnosis. When you have IC, it means you have the symptoms of frequency, urgency, pressure, pain, but they don't necessarily understand why. So what we're trying to do now is figure out why. We don't want to just spend the rest of your life chasing symptoms. We want to fix the underlying cause, whatever it might be. So was there any event that you associated with the onset of your symptoms? Did you have a baby? Had you been in a car accident? Was there a fall? What happened back when you were 21 years old? Okay. Ashley says she feels like everything is going to fall out when you stand up and like I'm being stabbed. Okay, so that's not a bladder symptom. That's a muscle symptom. You had a child at 18, okay, and you have endometriosis, and that's when they found you have IC. Okay, so when you had your child at 18, was that an easy delivery or were you torn? Did you suffer any trauma during that delivery? They cut you. Okay. So they did an episiotomy. Was it okay, so they did a big episiotomy. Do you only have that one child or have you had multiple children since then? Just that one delivery or have you had multiple deliveries? Multiple children. You have 3. Okay. Were they all natural childbirth or did you have any C-sections? Ashley said the last one they let you rip. How old were you when you had your last baby? In your 30s, in your 20s? The middle one was a C-section. Okay. How about the last one was natural, but they allowed the tissue to tear. Okay, so you'd already had symptoms for 7 years by the time you had your 3rd baby. So the odds are, and you had no history of bladder issues before you were the age of 21. How about immediately after the first childbirth when you were 18? Did you have any incontinence then? Were there any symptoms that happened? Okay. So take me back to when you were 18 and you just had that baby. Were you peeing normally then? Did you have, no, you just had painful periods. Okay. When they, and did you have surgery back then to remove endometriosis? So you guys, please remember, I'm not a doctor. I can't give you medical advice. My job is to educate, inform, and send you back to your doctor with a new set of questions. And that's what we're doing right now. What we're trying to understand right now is a little bit about Ashley's history. So you didn't have problems urinating until after the endometriosis surgery. Did they remove endometriosis from your bladder? Was it attached to your bladder and did they have to scrape it off of your bladder? It's a horrible thing for a 21-year-old to be going through. Now, you're very similar to my friend Diane. She had the same thing and they did a hysterectomy when she was 21. When they checked for IC, they put 3 different meds in. Okay, and I didn't know I had to pee for almost. Okay, but that's not my question. My question is, was the endometriosis attached to your bladder? Yes, the endometriosis was on the bladder, and you've now had a hysterectomy. Okay, so here's the deal. You've had 4, probably 5 major pelvic traumas. You had your first pregnancy when they did an episiotomy. Then they removed endometriosis that was on your bladder. Then you had baby 2, which was a C-section. Then you had baby 3, where you were torn. And she says the last time that she had it, it was on your bladder big time. So there really are, did it perforate through your bladder into the inside of your bladder? Was it only on the outside? Like, did they have to cut it off of your bladder and do an incision, or did they just scrape it off on the outside? Do you know? You're not sure. So there's no way that your muscles and nerves have not been affected by what you've gone through. So our question becomes, do you have a fundamental bladder disorder, or do you have something else that's affecting your bladder? And a couple of things come to mind here. One thing that comes to mind is that endometriosis wraps around anything it can wrap around. It can wrap around your bowel. It can wrap around your bladder. It can wrap around nerves. It can wrap around all over the place. And so the delicacy that it takes to remove endometriosis from some of these areas is extreme. It's important. And so I would want to know if you're having any neurological symptoms, like, do you ever feel pins and needles? Do you ever feel like you have areas of numbness? Anything at all like that? Do you ever feel poking, like pinpricks? You ever have anything like that on your vulva, on your perineum? Or do you ever have sciatica, pain that shoots down your leg? Or do you ever feel a fluttering or a tingling? Yes, all over when I take a shower. It's like being stabbed. Okay. So what that is, and your legs go numb. Okay. So clearly your nervous system involved, and clearly your central nervous system is involved, and your spinal cord is involved, your lower spinal cord. So that sensitivity on your skin, that's central nervous system sensitization. I have the same thing. I have exactly the same thing. And so it's where your skin gets super, super sensitive. Like, I can't wear wool. Going to sleep, it was like I was being poked with pins. I couldn't go to sleep because I'd have this big tub of lidocaine or a lotion, and as I was laying in bed, I would put it wherever I felt the pinpricks, and they were all over my body. They'd been left side, right side, front, back, wherever. That's called small fiber polyneuropathy. That means that the smallest nerves in your skin are now sensitive. And so you're not insane. It's not your fault. It's not all in your head. I'm just reading another paper. Okay, girl, I got you. So we now understand why patients get multiple pain conditions. The sensitive skin. I bet. Do you have a wicked sense of smell? Can you smell things that other people can't smell? And do smells drive you crazy? Anybody out there? Do you have a sensitive sense of smell? Like, is your family like, what the hell is going on with your smeller? I can smell things that other people in my family can't smell. So do you have a wicked sense of smell? Donna says yes. Yeah, I do too. Okay. So Ashley, how about you? Do you have a wicked sense of smell? Can you smell things that other people can't smell? And do smells drive you crazy? She says, yes, in capital letters. Isn't it weird that I know that? It's so weird, right? Here's this total stranger going, yeah, you got a sensitive sense of smell, don't you? Okay, smell is a brain function. Smell is a brain function, entirely in the brain. And so what we think has happened now that, remember, we have subtyping now. So we have different types of patients. We got patients with Hunner's lesions, et cetera, et cetera. One of the bigger subtypes are patients who have multiple pain conditions. They got the IC and the IBS and the vulvodynia and the fibromyalgia and the TMJ and the migraines. If you have 2 or more pain-related conditions, your diagnosis is chronic overlapping pain conditions. Okay? That small fiber neuropathy, that sensitive skin, that wicked sense of smell is proof that you have central sensitization. I have exactly the same thing, and a lot of IC patients have this. So what is it? Well, what the research is showing us is that it is basically the result of injury/trauma. And do you have anxiety disorder? Are you struggling with anxiety and catastrophic thinking? No shame, hun. No shame. I have it. It's no shame at all. So what the research studies have shown us is, and this was the Chronic Pain Research Alliance, all the patient groups for all these related conditions got together. And they went, we need to figure this out. And they funded this incredible research team. And their research team, that is the team that has answered these questions for us. So when you study somebody who has chronic overlapping pain conditions, wicked sense of smell, all this sort of stuff, what they see is a central nervous system that is living in a state of fight or flight. So this is about the most primitive part of your brain. So if you were to open up your front door and you see a tiger across the street walking towards you, the most primitive part of your brain, and the girl, there's a total happy ending here. Do not freak. There's a total happy ending here. Okay. But explaining it's a little weird. So if you were to open up your front door and see a tiger running towards you, the most primitive part of your brain takes over. It's called the sympathetic nervous system. What does it do? It has one job, and that is to save your life. So it increases your heart rate, it increases your blood pressure, and it tightens your muscles because it's preparing you to fight or flee or freeze. Okay? Now you don't go out on your porch. You shut the door. The tiger cannot get in. You call the authorities. They come out. They put the tiger to sleep. They put it on a truck. It is gone. It is gone. The threat is gone. And at that point in time, once your brain senses that the threat is gone, this fight or flight should turn off. The parasympathetic nervous system takes over and it calms everything down. It reduces your heart rate. It reduces your blood pressure. It relaxes your muscles. Okay? That's the way, and there's no cognition happening here. This is the primitive part of your brain. It only pays attention to sensory information. It's lower brain activity. So what the research found is that that's not happening to us, for us. We are stuck in fight or flight. The calming center of the brain is not turning itself back on. And how do we know that? Well, because most patients have anxiety disorder. And not just little anxiety disorder, intense anxiety disorder, because this is a brain that literally every minute of the day is scared for you. So we had a conference a couple of years ago, the International Pelvic Pain Society, who went through this, and it was an amazing conference. And their model was a woman who, in her teenage years, had pain from like endo. And then in her 20s, she had maybe vulvar pain. And then in her 30s, she had maybe bladder pain. And then in her 40s, she had bowel pain. It was this kind of ever expanding pain. And the connection being more and more nerves getting involved and an extended state of fight or flight. So why does this happen? Why did this happen to me? And why has this happened to you? And why has this happened to Donna and so many other IC patients? Well, for 80% of the kids that this happens to, there is a major physical trauma, like breaking your leg, a bad fall if you were an athlete, something at all like that. We know that 14 days of pain puts the brain into a constant state of fight or flight. And then for the other 20%, there's a history of bullying or abuse. And so in my case, I grew up in a neighborhood with a rapist murderer. He was a kid, a very mentally ill kid my age. And I was attacked. And the year that I went away to college, he raped and murdered my neighbor. I was not able to leave my house without fear for a decade. So think about what that did to my central nervous system. My brain became habituated into fight or flight. And the problem with fight or flight is your muscles stay tight for a long period of time. So now we have a muscle tension and your nerves become more and more sensitive. It is, what's the word I'm looking for? It'll come to me. So therapeutically, bladder therapies will not fix this. What we have to do, okay, well, let me take this back for a moment. When you're in extended periods of fight or flight, and you're this primitive part of your brain trying to figure out what the hell's wrong, it's paying attention to your sensory information. If you're laughing, your brain goes, well, she's laughing, therefore her life must not be at stake, therefore it must be that not life-threatening, and your brain throttles down the pain. You feel less pain. But if you're crying, your brain goes, uh-oh, she's crying. Her life really must be at stake, and your brain intensifies that pain because it's trying to get you to take action. So your first baby could have been that, and the fact that they did a very, very large episiotomy, that could have created the foundation that eventually involved your entire central nervous system. And that explains why you have the sensitive nerves on your skin, and it explains why you have anxiety. So the question is how do we turn it off? We know exactly how to turn it off. We have to turn it off by turning off this primitive part of your brain. And it's very easy to do because it's just about telling your brain you're safe with good sensory information. Nobody is saying this is mental illness. Nobody is saying in any way that this is your fault. This is not mental illness. It's not what's wrong with you. It's what happened to you. You have a nerve injury. You know, your nervous system has been traumatized. And so so what we now have to do is tell your nervous system that you're safe, and we have to do things that will focus on calming your nerves down. For example, this would be really interesting for you to try Peora, Peaora. This is so that stands for palmitoyl ethanolamide. We had a research study in 2019 that showed that 87% of IC patients who used this by month 3 had a significant reduction in their pain. There are dozens and dozens of research studies. This is a simple fatty acid that's derived from eggs. No side effects in the IC study. No side effects in the great majority of studies. So when all this small fiber polyneuropathy research came out a couple of years ago, and it helped me understand why my skin was so freaking sensitive, I'm like, okay, well, they say this calms nerves down. I'm going to try this to see if this calms my skin down. It's gone. I no longer have pinpricks. I've used this for 2 years. I used to have to take pain meds to fall asleep some nights. The pinpricking was so bad in my skin. I have no pinpricking in my skin with this. None. And what's cool is it's like the cheapest supplement we have. It's derived from eggs. So it's called palmitoyl ethanolamide. So it would be very interesting for you to come on over to the IC Network store. It's right on the front page. And you can copy and paste the scientific name and then Google it. Look at the research. There are dozens and dozens of research studies with us. Acute pain, chronic pain, fibromyalgia, sciatica, burning mouth syndrome, surgical pain, etc. This is that all the doctors, when they presented this as an IC study, were very excited to have something that they could recommend that was not an opiate that would calm nerves down. So if you consider the concept of taking Elavil or Neurontin, those come with side effects. And yeah, would they prescribe those to somebody with with sensitive nerves? Yeah, they could. But this, as the over-the-counter supplement, has no side effects. And most doctors would now say, let's try PEA first. So it'd be fascinating to see if you have the same reaction to PEA than I do. But again, I'm not a doctor. I can't give you medical advice. Google it. Palmitoyl ethanolamide. You know what? I'll just type it in here. Pelmito. Here, whoops, hold on. Pelmitoyl. There it is. It stands for PEA. Cut and paste that, put it into Google, and look at the research yourself. It's something that, and it's something that everybody is very excited about now, that we have something like this that can help calm nerves down. But we also have to tell the brain you're safe, because right now your brain's living in fight or flight, and the way we do that is with good, safe sensory information. So it'll take me less than 5 minutes. Let's do my favorite tool for turning off the fight or flight response. Okay, we'll do it right now. So for everybody out there, let's give it a shot. Okay, we're going to do I Spy. I double dog dare you to try it. Okay, so let's all take a quick deep breath in and out. Let's do it one more time. In for 4. Hold for 4. Out for 8. One more time. In for 4. Hold for 4. Out for 8. Okay. I want you to pick something in your room that you like. Pick something in your room that you like. I'm going to pick my Happy Halloween bear. Okay? Pick something in your room that you like, and let's just look at it. Just a couple of seconds. She always makes me smile. I'm 62. I love teddy bears. Deep breath in. Deep breath out. Okay? Now, besides my voice, can you hear anything? Do you hear TV in the other room? Do you hear somebody talking? Do you hear a radio on? Do you hear wind? A furnace? Focus on the sense of sound. What can you hear right now? And just pay attention to it for a couple of seconds, okay? Deep breath in. Deep breath out. Okay, now we're going to go to smell. What can you smell right now? Can you smell anything? Is dinner cooking? Or do you have something? This is where aromatherapy, this is why aromatherapy can help, because it engages that part of the brain. It takes it away from the pain response. So I always have these little Mario Badescu room sprays. facial mist. So focus on your sense of smell. A couple of seconds. Okay, deep breath in. Deep breath out. All right. Do you have any taste in your mouth? Any flavors in your mouth? I taste my latte. Actually, frappuccino. What can you taste? What can you taste? Focus on that for a couple of seconds. Okay, deep breath in. And a deep breath out. Nice, Sherry. Okay, now comes the fun part. It works every time. If you could look at anything that would put an immediate smile on your face, what would that be? Would it be the beach? Would it be a waterfall? Would it be waves? Would it be a snowfall? What could you look at? A dog, a cat? What could you look at that would make you happy? I want you to close your eyes and visualize that. And I'm going to go for ocean waves on a warm sandy beach. The pelicans are flying over. It's wonderful. The sun is shining on my face. I am safe and happy. Okay, deep breath in. Deep breath out. Okay, what could you hear that would put an immediate smile on your face? What's your favorite thing to listen to? Is it children laughing? Is it, again, ocean waves? Is it your favorite music? Like for me, BPS or Kenny Loggins? Think about your favorite song. Close your eyes, and I want you to imagine that sound for a couple of seconds. The Kenny Loggins Winnie the Pooh song. Deep breath in. Deep breath out. What could you smell that would put an immediate smile on your face? What is your favorite thing in the world to smell? For me, every single time it's baking cinnamon rolls or coconut. But baking, think you got cookies in the oven, you got cinnamon rolls baking in the oven. Think about your favorite smell. It could be the smell of the ocean or the smell of your lover. I want you to close your eyes and imagine that smell. And it's so good. My mouth is watering. It wants those cinnamon rolls. Deep breath in. Deep breath out. All right. What is your favorite thing to eat? What flavor do you love? And don't worry if it's not icy friendly. If it's coffee, it's fine. What is your favorite thing in the world to taste? And again, it could be chocolate, could be a hot cinnamon roll, could be a cookie, could be your lover. Close your eyes and go there, and that you are enjoying this flavor. Deep breath in. Deep breath out. And last but not least, what could you touch that would put an immediate smile on your face? What could you touch? Would it be petting a cat in your lap? Would it be ruffling the hair of a grandchild? Would it be freshly clean cotton sheets? What is your favorite thing in the world to touch? And I'm sorry, cat in the lap, that's it for me. Give me any animal sleeping in my lap, I'm petting them and I'm enjoying that tactile information. Close your eyes and visualize it. Fire's burning. Something great's cooking in the oven. Life is good. Okay. Deep breath in. And a deep breath out. Okay. How do you feel? Do you have a smile on your face right now? It works every time. Every time. Because we have just given the most primitive part of your brain all the messages it needs to tell you that you are safe. It's sensory. There's no thinking your way out of it. It's good, safe, sensory information. And this I Spy technique is excellent for children. If you have a child who doesn't want to go to school, or you're just hanging out with a grandchild or whatever, sit on the back porch and do I Spy with them. Honey, what could you look at that would make you smile? This is a great, fun tool to teach to children, especially children that are under stress. And it's great for adults too. Whoops, did Facebook just freeze? Looks like Facebook did something. Oh, there we go. Now the challenge here, so we have just taken your brain completely out of fight or flight, and this will last for hours, hours and hours. It works every single time. The challenge is, the other piece of this giant puzzle is we have to understand that a brain that is in fight or flight is anxious. It's an anxious brain. And an anxious runaway brain produces a lot of anxious thoughts. And so odds are you the no girl. Hey, you want to go for a drive? No, it'll hurt. Hey, you want to go out to dinner? No, it'll cause a flare. You want to have sex? No. Stay away from me. Hey, you want to go on a vacation? No. Okay. You're the no girl or you're the no guy because your brain's guarding. It's guarding. Your brain's just trying to protect you. Well, the legacy of that is that those negative thoughts are scary. Hey, you want to go out? No, it'll hurt. You've just triggered fight or flight again. Every time you have a negative thought, you reinforce fight or flight. Your brain goes right back into fight or flight. So the second piece of this puzzle is we gotta get the anxious thoughts under control. And again, nobody's saying that IC is all in your head. Nobody's saying that you're mentally ill in any way, shape, or form. We're dealing with the concept of injury or trauma. We're dealing with the concept of a brain that has been through something. And so we have to teach the brain what good, healthy function is. And so, the thing that I think turned me around early on when I was 35 years old. My IC started when I was 32. I mean, my pain started when I was 32, my bladder pain, was I took an anxiety management class that completely changed my life. Man, I used to have panic attacks going to the doctor. I would pace crying out in my backyard, same backyard I'm at now, because I always thought I was going to be hurt. And one day I was just like, I'm done. I don't want to do this anymore. I need help. And I already had a master's in psych, and the IC Network was my PhD doctoral, proposal for getting my doctorate in psychology, right? And I still had trouble with it. I had no skills. So I took an anxiety management class. It completely changed my life, and I have not had a panic attack since I took that class. I've come close a couple of times, but I have not had an out-of-control panic attack. So when I went to the class, what was interesting, the first thing that was very cool about it is when you walked into it, it's like, oh my God, we're all normal people. Like when you're living it, you think everybody can see you have anxiety and this weird thing going on. No, nobody can see it. It's all hidden. You're not an abnormal person. You're a normal person who's been through something. And when you walk into a room with other normal people who have been through something, it's very comforting. Like in my class, we had the family that won the first lottery in California. They developed anxiety disorder after winning the lottery. Okay, so that was cool. So the class was taught by an orthopedic surgeon with anxiety disorder. And he said, listen, I'm not here to figure out why you're anxious. I'm not here. We're not going to go back into your child and figure out what the heck happened. If something happened, I will help you get the care you need for that. I'm here to teach you a skill. I am here to break you out of fight or flight because you're stuck. You're spinning in a circle. You're stuck anxious all the time, right? You know, like we're like, yeah, right, all the time. So he explained the chemistry of it. And he said, listen, just as you can be sensitive to chemicals on the outside, you are very sensitive to chemicals on the inside. And the chemical that you're living in right now is adrenaline. You have got so much adrenaline floating through your body. That's what's driving all of this. That's what's driving the panic attacks. That's what's driving all the stomach ache, the dizziness, everything. That's coming from an overdose of adrenaline, which of course is part of fight or flight. That's the chemical that your brain uses to prepare your body to fight or flee. It's adrenaline. And he explained, listen, every time you have a negative thought, you get a jolt of adrenaline. And the problem is you don't just have one negative thought. You got like 100 thoughts a day. You got 100 shots of adrenaline a day, easy. And we're like all going, yeah, that's true. I'm having negative thoughts every other day. I'm like the doom girl. So you don't just have one jolt of adrenaline, you have hundreds of jolts of adrenaline floating through your body at any given time. And of course, you have a headache. And of course, you have a stomach ache. And of course, you feel lightheaded. That's adrenaline. So we're going to break you out of that. We're going to get you out of adrenaline. So how do we do it? He taught us a 3-step system. Step number 1, as soon as you have a negative thought, the first thing you do, stop sign. Just close your eyes and visualize a stop sign. Just stop. You're just turning it off for a moment. And the odds are you're probably already doing that because anybody with anxiety disorder gets sick of it. Stop. Stop. The second step, after you have a negative thought, is a single deep breath. In for 3 and out for 3. And here's what's amazing. That oxygen turned off the adrenaline. It rendered it chemically neutral. So you have a negative thought, you get a burst of adrenaline, you take a nice slow deep breath, and that adrenaline is now rendered chemically neutral. It's done. It's over. Stop sign, deep breath. And the third step is you just have to remind yourself it's a negative thought. It has no power. It's just a brain stuck in fight or flight. So it's important to have something to say to yourself. So what I say to myself is, oh my God, Jill, you're not God. You can't predict the future. For goodness sakes, it's just a thought. It has no power. For all you know, tomorrow is going to be a blessed day, one of the best days of your life, right? Okay. Stop sign, deep breath, minimize the thought. 3 steps. He said, okay, we have one goal for this coming week. We just want to get you out of adrenaline overdose. So as soon as you walk out of this room, I want you to start it. Now I'm a chemist. I've got chemistry degrees. I'm like, okay, I got nothing to lose. The chemistry is interesting. I'll give it a shot. I had my first negative thought as I was walking out of that room. It'll never work. But I did it. Stop sign, deep breath, minimize the thought. Oh my God, Jill, you're not God. For all you know, this is going to work great. And for the first time in years, decades, because I took this class when I was 35, I developed anxiety in high school. No, junior high, maybe. I was shocked. I had gotten so used to it that I was just ignoring it. But literally every other thought was a fear thought. And they weren't just fear thoughts, they were mean thoughts. Oh my God, Jill, who would ever love you? You're pathetic. That's what I was saying to myself. Your pathetic excuse for a daughter. That was the brain chemistry that was going in my head. Okay. But I did it. Stop sign, deep breath, minimize the thought. At least 100 times the first day. And I was truly shocked. I was shocked that I was living with so much fear. Second day, I did it about 50 times. Third day, I did it about 20 times. 5 days later, once. I only had to do it once. And for the first time in 20 years, I was comfortable. I was at peace. I was like, wow, this is amazing. I was calm. I was calm. My body was calm. And that's what I learned. And I got to the point where prior to COVID, I was doing it maybe once a month. Now, listen, I'm very in tune to this. I know that my job is to get myself out of adrenaline overload. I pay attention to negative thoughts now. As soon as I have one, stop sign, deep breath, minimize the thought. I have 2 in a row, I double down. I rarely have 3 in a row. I mean, I went through emergency surgery for uterine cancer. I was doing this in the car. I did not have a panic attack on the way to the hospital to have surgery. Stop sign, deep breath, minimize the thought. Now, listen, COVID changed everything. And I got back to doing it every day, once a day. But that's okay. I understand that stress. We are all under stress. There's no shame in having an anxious thought. We just have to understand the consequences of those anxious thoughts. We got to nip those suckers in the bud. We got to nip those suckers in the bud. And so stop sign, deep breath, minimize the thought. I please try it. Do it for a week. I double dog dare you. Let's see what we can do. No shame, no blame. No shame, no blame. It's not what's wrong with you. It's what happened to you. And again, if you have Apple Plus TV, please watch the Prince Harry Oprah documentary that goes through this in depth. It's so good. And so once you get your brain chemistry and your body chemistry kind of calmed down, the load, it lightens tremendously. It was like, oh, wait a second, I'm a good person. Oh, it was never my fault. Oh, wait. I don't have those negative thoughts anymore about me as a person. I understand everything. I understand that none of this was ever my fault. Ever. And it's not your fault either. It's not what's wrong with you. It's what happened to you that matters. So getting back to the whole central sensitization, chronic overlapping pain conditions, our therapeutic priority is to calm the central nervous system down. We're going to calm nerves down in a variety of ways, like using PEA or Neurontin medication that can help. But we also have to go ahead and accept the fact that anxiety is not helping. It's making it worse. So we gotta go, okay, I need a little bit of help with the anxiety. Let me learn some new skills. If you've got an anxiety management class that you can take virtually or go to your local hospital, do it. Because God didn't give us the skills to deal with COVID when we were born. We have to learn these skills, and we don't have to fake it anymore. We don't have to pretend we know everything. We know very little. We have to learn skills. And that's why working with a professional is great, because it's about just skill building. An anxiety management counselor and therapist, they've already worked with hundreds and hundreds. They know what works. You don't have to figure this out all on your own. And so if there's a therapist that can help, go for it. If there's a class you can take, go for it. I have a video. You can watch my video. And there are moments when it's really nice to talk to somebody else. There are moments when it's really nice to just bare your soul and get it out and get some feedback. But again, nobody's saying that this is mental illness. What we're saying is that there's trauma, there's history that's involved, and we've got to just kind of calm some of these things down. The more agitated your nervous system is, the more pain gets intensified. The more calm your nervous system is, the more pain gets minimized. And it's just so exciting, because we're no longer expecting you to do bladder therapies for the rest of your life that will never work. We're no longer going, okay, let's just chase the symptoms. Let's just medicate you so that you're so freaking drowsy you can barely talk. But yeah, you're only getting up 2 times a night. That's not the way. That's not a good way to live. We want to try to fix the underlying cause. And if the underlying cause is estrogen atrophy, then we're going to treat the estrogen atrophy. If the underlying cause is tight pelvic floor muscles, we're going to treat that. If the underlying cause is a history of abuse, then we're going to acknowledge that. It happens. I'm so, so sorry for those of us who have been there. But it's over, hopefully. And we understand the ramifications of it, and we can make better choices now. So anyway, I hope that helped just a little bit. Sometimes it's a little overwhelming for those of you out there. If you just feel like this is way over your head, I've got videos on our website. I'm happy to try to talk to you. And again, tomorrow we've got our big National Institutes of Health IC meeting. It's dedicated to this. It's going to be so cool, but I'm going to have to go to bed early because I have to get up at 5 in the morning. So anyway, so we've been doing this now for three and a half hours. Thank you, Donna. Thank you, hon. Thank you. Oh, come on, here. It's this. It's this. All right, guys. Well, listen, last call for questions. Renee said, I just found a new therapist. It is helping. Good. No shame. If it helps, it helps. The important point here is just we're not alone. We're not alone. None of you are alone in this. We are all in this together. And the blessings, the true blessing of the internet is that, and my goal when I built the IC network was I wanted to bring the world's best resources to patients who were completely isolated. For those of you who didn't have access to good doctors, I wanted to bring you good, really information. Rhonda says, where's the meeting? It's a virtual meeting and it's in DC. It's being facilitated in DC and it's for doctors and researchers mostly. So I will do an extensive report. I will record it and I will do an extensive report on it. So you guys, yet again, listen, if you would like samples of pre-leaf stir-ins, please email me your address, icnetwork@mac.com. These are dissolvable pre-leaves that will reduce the acid in whatever you're eating or drinking. I'm happy to send samples out. I would really, 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 really appreciate it if you could send my dad a 100th birthday card. And now that we're near the end here, I can actually type the address in here. And says, what you eat in the morning, does it affect your bladder at night? It could, sure. So if you want to send him a 100th birthday card, can you send it to, and I'm typing this into Facebook first. Let's see, hold on. Jack Osborne, care of Jill Osborne, and it's 122 Calistoga Road, number 203, Santa Rosa, California, 95409. All right, so let's see, 4 birthday cards. So, oh, great, Donna. I will definitely send you some. All right, and now for YouTube, let me give you guys this address here. If please, and if you have any IC support groups, can you pass this along here? I want to surprise them. So I'm typing the address over on YouTube too. Calistoga Road, number 203, Santa Rosa, California, 95409. Thank you, thank you, thank you. It has been quite a journey. Renee says, how are we doing us? Yeah, if you could. I mean, I would love it. If you got any kids who want, she says, can we send more than one? Definitely. You know, it is surreal watching somebody be 100 years old and how he's, you know, he was taller than me and now he's probably shorter than me by like 5 years, but he's, you know, in his brain, he's still the man of the house. He's still 25 years old. He still wants to be the protector. He wants to have his driver's license. He wants all of that. And it's hard. It's been hard for him to accept the fact that he can't do those things anymore, that I'm the decision maker now. We had our refrigerator die. A couple days later, our water heater broke and leaked, and then something else happened. You know, and it's like, Jill, like, okay, I'm having to do all that. So anyway, all right, you guys. Well, listen, we still have a bunch of people watching on YouTube. So I'm going to do a last call for questions. Any other questions? I'm happy to take any questions you have. Otherwise, we'll go ahead and call it. Rhonda said, but he looks great. Thank you. I am blessed. He's crotchety. Let me tell you, he's crotchety. He's a handful. He's the one that's going to raise my blood pressure more than anything. Just the whole argument we got in about driving. Like, he doesn't want to wear his driving glasses. You're welcome, Lee. You're very, very welcome. We had a huge argument because he wanted to drive. He wanted to renew his driver's license. And it's like, Dad, you failed your eye exam. No, I didn't. You did. No, I didn't. I can drive. Dad, I was there. You went to the DMV. You failed it. We sent you back to the eye doctor. And we had to get glasses. And even with the glasses, you barely passed. And he's like, no, my eyesight's fine. It's like, it's not fine. These moments, you know, this is hard for him, but it's really hard for me too. So, to be the bearer of bad news. So again, if you could send him a card, I would really appreciate it. He's a good dad. He tries very hard. He sings my mother awake and asleep, but he has a prickly side. So, and we disagree entirely on politics. That's a whole nother story. All right. Well, listen, since we don't have any other questions, I think Renee says, no, he's not going to raise it. Remove yourself from it nicely. Get some ice cream. I'm getting better at that. Give him some, yeah, I know that distraction. It's all about the distractions, right? You got to have a good sense of distraction. I'm getting better at it, but we've had some very, very difficult moments, you know, and it's hard because I'm not getting paid for this, you know, so I have to choose between working, and it's like, I have to work because I've got to earn my retirement, you know, and so it's challenging. All right, you guys. Well, listen, I'm going to let you go. Be well. Have a wonderful week. Hopefully, I will see you again later this week. Send good vibes, all the way good vibes back to you. And I absolutely wish you the best. I'm going to go take a walk now. So I will see you guys later. Have a good one. All right. I love you right back, Donna. You guys are wonderful. You're wonderful. All right. Goodbye, YouTube.